Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 virtual Relay for Life Guam.
Be healthy. Be informed with ITD.
Calling all graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
It's not always easy trying something new. Sometimes you have to help your loved ones along. Nana is so used to her weekly trips to the bank that going online can be a little scary for her. But her grandson knows that banking online is safer and easier. So he's teaching her how to get started using Bank of Guam's online banking videos. Teaching is one way to show our loved ones we care. Keep your family safe at home and show them how to bank online. Find easy-to-use online banking tutorials at bankofguam.com or on our Instagram and Facebook pages. Bank of Guam, member FDIC.
Be healthy. Be informed with ITD.
Panogita moru purita nonda kantai mantunat nyagi toru ilugar para honra para gloria abiba islasen para honra, para gloria, abiba islasen para todo y tempo y paz para ita dan gini langit na bendición contra y peligro na sa fuham Deus protegis Guam contra y peligro na sa fuham Deus protegis Guam.
I just got the news today. Things will never be the same. Things will never be the way it was just the other day. They told me it'd take my life without even a chance to try. I'm not even gonna question why. I just know it's my time to fight. We'll never give up, never stay down. Stand back up, put your feet on the ground. We all know we must fight to survive. So live life alive, it's alright. Never give up, never stay down. Stand back up, put your feet on the ground. We all know we must fight to survive. So live life alive, it's alright now. She just got the news today. They told her she had only days, but she don't really feel that way. She just tucks her head and prays. They told her it'll take a life. Imagine how she felt inside. Though she didn't even question why, she just knew it was time to fight. We'll never give up, never stay down. Stand back up, put your feet on the ground. We all know we must fight to survive. So live life alive, it's alright. Never give up, never stay down. Stand back up, put your feet on the ground. We all know we must fight to survive. So live life alive, it's alright now. You can make it if you try. Don't give up, keep up the fight. 'Cause we can make it if we try.
Always feeling this one, man. The late, great Savage K. Live life alive. Good morning, Guam.
Never give up now. We'll never give up. Never stay down. Stand
622
back up, put your feet on the ground. We all
on your official virtual Relay for Life station. Hey, good morning. Good morning, Sabrina.
Hey, good morning.
There's nothing like the fresh fit of a new mask and the smell of Clorox in the morning. I kind of gotten used to it.
Yeah. I like the one that we got at is it 7 Day?
Which one?
This one.
Yeah, because the Lysol never came in, apparently.
Spray disinfectant.
We're probably going to
Citrus
find out in
scent.
a couple weeks. It's going to be like, yeah, this is full of like stuff that kills you.
Hey,
It smells good.
it does.
Good morning on you. 622. It's the KUAM News takeover of containing COVID, and it's all proudly brought to you by Cowboys Insurance, Ambrose Inc., Coast 360, the Bank of Guam, and IT&E. As always, a great big, giant, huge show for you guys. Department of Labor, we'll have the director on to kind of unpack yesterday's press conference, and we've got that tutorial video We'll play that later on to kind of walk you guys through this process. A very complicated application process is what we're hearing. The Ken Sanity of our digital team was talking about his experience in helping a family member. We'll just leave it at that. His wife, when they were filling it out. Well, she's like an HR manager, and so if an HR manager is, I don't want to say having a hard time, Ken, but it is a complicated process, and some people saying it takes up to 40 minutes, and then you have to apply every week to keep the benefit going. So
what? Really?
Yeah. So right. You want to get on? Ken Sanity, ladies and gentlemen, legendary gamer.
Sorry, yeah. So I guess you have to apply for every week. Right. So I mean, like, you know, if you're going to backdate 13 weeks worth of unemployment, then you obviously have to fill in a separate one for each of those weeks.
Wow.
But it's pretty complicated. I mean, there's, I don't know. Like, I guess, some people, maybe they're unemployed for the entire 13 weeks, so it's pretty simple. Each one of your filings is going to be identical, right? Pretty much. But then, like, I mean, what if your work status changed? What if you had, increased hours? Like, maybe you added 20 hours to your work week or 16 hours. Like, the amount of money that you made, like, could prohibit, how much of the aid that you qualify for. So, I mean, it's
right. The more you work, the less you get, is what it is.
Yeah, for the everyday person, it's not going to be the simplest process. But, I mean, it works. So we'll see. I mean, it's time consuming, but I mean, I guess you would need all the checks and balances that you would need to make sure that you qualify for the correct amount of money.
Right. I mean, unfortunately, if there's one thing that our people have learned during this time of the COVID, it's how to wait and be patient. So, yeah, we'll have more on that. I know GCC, they're standing up. They got all this CARES budget funding, or it's in the budget proposal for the CARES Act.
Right. According to that breakdown provided to the legislature weeks ago that BVMR provided, I believe it said it was like $100,000 for Department of Labor to go to GCC for this processing center. Right, and so we'll have more on that coming up here. 6:25, the second day of June. As always, we start the show with a dive into the day's COVID-19 headlines from the KUAM News team. Good morning, Sabrina Salas-Manzanani.
Hafaday and good morning, everyone. Following 2 additional cases that were reported Monday, the number of COVID cases on Guam stands at 175. As for testing conducted yesterday, 27 samples were run through Public Health's lab and 0 returned positive. Again, those are only for samples from Public Health's lab. They do not include results from other labs at GMH, GRMC, or DLS, or the National Guard. Governor Lulian Guerrero signed another executive order, this time to officially launch the Pandemic Unemployment Assistance and Federal Pandemic Unemployment Compensation programs. But officials say they're still working out the kinks and asking for applicants' patience. Nestor Lecanto reports.
We have done over the weekend some testing, and now we are ready to move it forward. There are going to be some glitches, and we ask for your patience when that happens.
The Governor and Labor Director David De La Sola emphasized that not only is it a newly built computer program, an unemployment program in and of itself is new to Guam. So far, more than 1,100 employers have submitted data showing more than 21,000 employees have been affected. GCC has offered to serve as the processing and call-in center to assist applicants. President Dr. Mary Okada.
With the help of our MIS team, and so they were able to set up a total of about 80 computers that were redirected from other areas of the campus.
De La Sola acknowledges that the application process will be one of the biggest choke points, and so the more computer assistance applicants can get, the better. That's why De La Sola says,
once we stand up the processing center and the training center, we can start calling the employers in and start training them so that they can better prepare their employees.
He says the program will be very strict, so getting the application right the first time will be crucial, so not to delay the processing.
You can't go back and change it because you can't go around and just keep changing and how much money you're going to be getting. It is something that has to be staff driven because of the this is a UI program, and it's very rigid as far as making changes once you checked off something and then you submit it.
By regulation, accepted applications must be paid within 21 days, but officials say they hope to make the payout sooner than that. For Guam's News Network, I'm Nestor Lecanto.
Although the application process is currently only available online, GDOL has signed a memorandum of agreement with the Guam Community College to stand up a processing center on the campus for those without internet access. Once the processing center is open, individuals can make an appointment and receive help with their applications. More information will be provided once available. For inquiries, call 735-0527 through 32, or you can email PUA, that's PUA, hotline@dol.guam.gov. The governor also signed another executive order related to launching the Guam Small Business Pandemic Assistance Grant Program. As we reported, a total of $20 million in CARES Act funding was directed to Guam's small business who have suffered financial hardship as a result of COVID-19 due to business closure, reduced consumer spending, and a decline in visitor arrivals. Gita is overseeing that program. For a list of eligibility requirements, you can visit investguam.com/smallbusiness. Applications are being accepted via email until the $20 million in funding set aside under the CARES Act is exhausted, or until December 30th, whichever comes first. Governor Lulian Guerrero standing by the statement read during a recent oversight hearing by her legal counsel, Hai Hyun, regarding Guam Homeland Security's Tim Uggin's involvement with the procurement of the first round of quarantine facilities. That statement essentially was that the HSA dropped the ball, so the governor instructed the legal counsel to take over the handling of procurement for the quarantine facilities. Although Lieutenant Governor Josh Tenorio said Uggin told him that he was not involved with the procurement, the governor, during a press briefing, said this was a responsibility of the agency and Homeland was the lead agency. Here's more as Adriana Cotero asked the governor about the situation.
I wanted to go back to an oversight hearing, Governor, that happened a couple weeks ago. It was in regards to the first wave of quarantine facilities, and it was done in an effort to understand procurement details. Your legal counsel, Hai Kun, had read a statement permitted by you to the Guam lawmakers that indicated that Homeland Security Advisor Tim Uggen had essentially dropped the ball on procurement for the facilities, and then at your instruction, your legal counsel took over. But since that hearing, Uggen has reached out to the minority leader, Senator Telotaigui, even the lieutenant governor, saying that this is not true. And the lieutenant governor telling KUAM this morning on our I-94 FM containing COVID interactive weekday talk show, which can be heard now and streamed on KUAM's Facebook and YouTube, which I recommend all listen to. But Lieutenant Governor explaining how he received messages from Uggen over the weekend saying that he was not involved and not instructed to do any procurement. So it's still a little unclear, and I was wondering if you could please just clarify if he was involved or not at that time, and who was in charge of the procurement for the Gov Guam quarantine facilities. Can you confirm if it was Tim Uggen?
So the purchasing or the procurement of the facilities, the quarantine, safe haven, and so forth, is a Homeland Security responsibility. And when we started having these cases, and we saw that there was the need to quarantine travelers from outside, because the contacts source for these positive cases were from the outside. The procurement started with the Homeland Security. The involvement of the legal counsel was to negotiate the terms and conditions, and he did that. However, I felt that it was not going as fast as it should be. Therefore, I instructed the legal counsel to quickly purchase these services and to quickly come up with the negotiations, the terms and conditions. And that's what happened.
So, okay. So just to clarify though, HSA is who was first in charge. Correct?
It is
it's
by,
under
yes, by the,
okay.
I think it's our pandemic plan, or by just the Homeland Security being the individual entity that's in charge of disasters and in charge of crisis and and disasters. They are the lead agency. They're the lead agency for the logistics, the procurement, the supplies, together with the Office of Civil Defense, just like we do when there is a typhoon.
Well, okay. So then, before I get to my next question, if I could just ask you, then, what's your response to Tim Uggan saying that he wasn't involved or didn't have a hand in any of this?
I can't speak for him, and I don't know what happened, what the conversations were with you guys. But again, the Homeland Security was the lead agency. It was not moving as fast as it should be, at least to my expectations. And that's why I instructed the legal team to continue on with the negotiations so we can move on and get the facilities.
As the reported Minority Leader, Senator Tello Tydegui also told KUAM that the Homeland Security Advisor Tim Uggan also reached out to her following that oversight hearing, saying Hyun's statements were untrue. They're finally home. On Monday morning, the Guam National Guard began coordinating the release of returning residents who were under quarantine at various hotels. Guard spokesperson Mark Scott says as of noon Monday, a total of 73 people were processed. 31 were from the Grand Plaza Hotel, 25 from Wyndham, and 17 from the Garden Court. This follows the governor's announcement last week, giving them the option of staying at a government facility or going home. The Guard assisted with transport and traffic management. Occupants could also arrange for personal transportation home. As reported, returning Guam residents will now be allowed to home quarantine instead of being forced to stay in government quarantine facilities. They must provide proof of residency upon arrival at the airport. In regional news, we bring in Tomas Manglotnia now, who is in Saipan with the latest on what's happening there. Tomas.
Good morning, Bing Chris. Here's the latest making news in the Northern Mariana Islands. The CNMI Division of Revenue and Taxation has issued approximately 29,000 economic impact statements, totaling an estimate of $45 million, according to Director Tracy Narita. She spoke to media in yesterday's briefing on a local radio show. Take a listen.
We have a monthly report going to the IRS on the payments that were processed. And so we have a monthly report going to the IRS on the payments that were processed. And so when that report is ready, I can share that with the media.
And just following up on something that Ashley asked about, when do you expect almost 100% distribution of all of these? Do you think by the end of July, or is there sort of a timeline that the office is working on?
Well, from what it looks like right now, we have actually reached our limit at 47.1 million. If we count those that are pending processing, meaning they are pending because an error is holding the check back. And so it looks like we may have to request additional funding. And that is the discussion that we will be having with the IRS soon. And so as far as clearing those pending payments, we are hoping to do that within
through the week who receive their payments. She says she encourages the taxpayers to keep the notice so that when they file their 2020 return, they will be able to have a reconciliation with that notice to claim additional credits should they be entitled to more. Narita wants the public to know that any adjustments to the EIP checks can be claimed on their 2020 return. She also says that anyone who received another individual's check should return it to the post office instead of posting it on social media platforms, which she says could be considered mail tampering. In that same press briefing, the CNMI's governor's authorized representative, Patrick Guerrero, told media that officially they've submitted $38 million in reimbursement requests to FEMA. Guerrero explained that the process now moves on to FEMA, who will create a project worksheet for the funding. They expect to answer questions throughout the next couple of weeks during the initial review. KUAM followed up on hotel contracts. Take a listen to this clip.
We have not maxed both facilities, but have come close. Right now, currently at PIC, we are, after receiving 30 plus passengers today, we are at about 170 guests currently staying with us. So the need for these quarantine facilities continues. Kanoa, if the public doesn't know, that has shifted from just serving as a quarantine facility for incoming passengers, and we've used it now as an isolation facility for what we call PUIs, persons under investigation, or confirmed cases. So we're separating incoming passengers that we hope are not carrying the virus versus those that we know are infected and are under CDC's watch. As far as the cost of these facilities and what we're paying for, well, to date, we've been working with both properties. They are giving us time to wait for our award from FEMA to be able to pay for the services that we've incurred to date. We requested from FEMA for the funding of the whole facility for every room, or I'm sorry, not for every room, but for the facility in its entirety. There's no way that we could, because we're not open to tourists and other guests, but we need to maintain every room to be available for the flights that are coming in. I know we're seeing 60 passengers at the most come in, but there's nothing to stop us from, or there's nothing to stop United from bringing in a full flight of 160 passengers. So back to the question, I guess we are renting the facility in its entirety.
And here are the latest numbers from the Commonwealth Healthcare Corporation's website. The number of cases in the CNMI remains at 22 with 2 deaths and now 16 recoveries. The number of persons released from quarantine is 564. And the updated numbers for community-based testing on Saipan, Tinian, and Rota are as follows. Saipan has tested 5,609 residents. Tinian has tested 349 residents. And Rota has tested 376 residents. Bring Chris, that's the latest here in the CNMI.
Thanks, Tomas. Back to news here on Guam. The Guam Police Department has launched a death investigation after a man was found lifeless Sunday night along Marine Corps Drive by Wise Owl Veterinarian Clinic in Tamuning. Several island residents gathered at the ITC intersection in Tamuning to stand in solidarity for the Black Lives Matter movement Monday afternoon. Racial tensions have risen around the United States following the death of George Floyd on May 25th. Floyd died while handcuffed and restrained in Minneapolis by police officer Derek Chauvin, who kept his knee on Floyd's neck throughout the incident. Another protest is scheduled for Friday at the ITC intersection, starting at 4 o'clock in the afternoon. In national headlines, President Trump is taking new steps to deal with the protests which have rocked the nation. Some of those even happened just yards away from his front door. Natalie Brandt has details from the nation's capital.
Graffiti on the Lincoln Memorial and glass on the sidewalk show just some of the damage from violent protests overnight. Washington, D.C. Mayor Muriel Bowser toured the city this morning.
I'm very angry that people would destroy their own city, or people who are come here and destroy our city.
The demonstrations in the nation's capital were peaceful throughout the day as thousands marched against racial injustice in America. But some began looting and damaging buildings after the sun went down.
All of us need to work to make sure that we stop destruction, but we are focused on what we need to do to change our country.
Some of the damage includes a fire in the basement of the historic St. John's Church near Lafayette Square, just across from the White House. Every president since James Madison has attended a service here. During a conference call Monday, President Trump called governors weak for their response to protesters.
We're strongly looking for arrests. You have to get much tougher. You're going to get over it. You have to dominate. If you don't dominate, you're wasting your time. They're going to run over you. You're going to look like a punching jerk.
In Delaware, former Vice President Joe Biden met with African American leaders to talk about how to diffuse tensions.
Everybody is perfect. Everybody's angry. Unfortunately, we have to do the country together.
The presumptive Democratic nominee said if elected, he would form a police oversight board in his first 100 days in office. Natalie Brandt, CBS News, Washington.
Also called for governors to pass laws banning the burning of flags. He said the government would support them if they took those measures and suggested the Supreme Court would side with them as well. And finally, an important reminder from the Guam Bankers Association, which is encouraging residents who plan to file for PUA to consider opting for direct deposit. You are urged to take the following steps by opening a deposit account with your bank. Collect necessary information to be prepared to provide your account number and the routing number, and also visit Guam DOL's online portal, hireguam.com, to apply for assistance. And that is your Banking 671 report, brought to you by the Bank of Guam and Coast 360. Chris.
All right, thank you, Bree. Good job. 6:43. We're gonna take a little break and come back with the director of Parks and Rec, John Birch, as the parks have reopened, but the bathrooms have not. And so Mr. Birch is gonna kind of explain that and tell us what measures, if any, DPR is taking to ensure cleanliness and your ability to mitigate the spread of COVID while you're relaxing at your gathering of no more than 25 people.
25?
Right? Isn't that the limit? Is gatherings of 25 now? Yeah.
I think so.
I was kind of thinking, man, do I know 24 people that I want to gather with? Yeah, I do. 6:44. So we'll take a break.
Do they want to gather with you?
Thanks, Bree. Good job.
Try McDonald's breakfast chicken. Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 virtual Relay for Life Guam.
Be healthy. Be informed with ITD.
It's not always easy trying something new. Sometimes you have to help your loved ones along. Nana is so used to her weekly trips to the bank that going online can be a little scary for her. But her grandson knows that banking online is safer and easier. So he's teaching her how to get started using Bank of Guam's online banking videos. Teaching is one way to show our loved ones we care. Keep your family safe at home and show them how to bank online. Find easy-to-use online banking tutorials at bankofguam.com or on our Instagram and Facebook pages. Bank of Guam, member FDIC.
Calling all graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
Be healthy. Be informed with ITD.
something about it. I discovered that no other man has seen before.
Hey, good morning.
She's got top brown eyes and ruby lips.
649. Looking at our comments here, we brought our Ken St. Nicholas on, part of our high-powered digital team, talking about the application process for the PUA and the FPUC. And according to Ken and some of our comments here, very time-consuming. It is what it is, though. Latoya writes in on our Facebook Live. Good morning, by the way, to our Facebook Live viewers on our Edward R. Murrow award-winning social media networks. Yes, very time-consuming. It's basically redoing the process each week. I'm helping a family member who is older, and it's frustrating for them. Also, understand as part of the process, you have to go out and apply for 3 jobs. I don't know if that's a weekly and I mean, that's a normal unemployment kind of thing, right? You can't just kick back and be unemployed. They want you to try and make an effort to go out and apply. So I'm wondering, I mean, that's going to create some traffic. The people out here go and apply to the first 3 businesses they can go to, right? Hey, can I get an application? Oh, you're not here for takeout? Okay. 6:50 is second day of June, and one of the announcements that was made over the weekend was the reopening of public parks and beaches. And so we wanted to bring on the acting director of the Department of Parks and Rec, John Birch, onto the show. Good morning, John.
Good morning, Chris.
So
Sabrina's on there with you?
Oh, yes, of course, good morning. You know it.
Good morning, Sabrina.
Good morning.
So how was it, John, with the reopening of the public parks and beaches?
Well, we've been pretty busy. I hope people understand that the process of reopening, takes time. All of this occurred because of the health crisis that we're in. I understand, or I hope everyone understands why our parks and beaches had been closed down, and basically is to prevent or stop the spread of the coronavirus. And during this time, I was brought on board. So I hit the ground running at DPR. I was brought on board as part of the governor and lieutenant governor's initiative to refurbish the facilities within DPR's inventory. So I've been kind of busy since I started at DPR. And the process of getting permits, getting things clear to start building or refurbishing takes time. Even in the private sector, if you're going to build a house, it takes a couple of months or so to get the paperwork done. And same as with the government. And especially if you're working with federal funds, that you have to make sure that you dot all the I's and cross all the T's. We don't want to waste any money. We don't want to return any money to the federal government. And we see this also as a way as to restart our economy by infusing some new money into the economy. Once you start spending money on projects, people earn money and then they go out and spend it, and it goes on and on. It's a domino effect across the entire island. So one is we're trying to accomplish 2 things. We've had problems with, over the years, complaints about the restrooms in our public parks not being up to standards. So during this downtime, we decided to take advantage of it and turn this crisis into something good. And so we decided to go through and start the repairs. And we went into Core 2 on right at the very beginning that the paperwork was completed and the repairs were actually started. So I know I'm going to get a lot of complaints, and I have been, that why are the restrooms closed?
What kind of complaints have you been, John, sorry, what kind of complaints have you been getting? What are the people saying?
They're saying we'll open the bathrooms there at the park. And why didn't we do this at the beginning of the crisis, at the beginning of the shutdown? And yes, we did. We were getting the paperwork done. It takes time. I hope people understand that you just don't say, I want to build something, and you just go out and build it. There's a lot of red tape you got to go through, and it usually takes a few months.
You couldn't use the emergency powers route?
I'm trying to make sure we do things following all the rules and procedures within Guam.
Right.
I was brought on board as the initiative to get it going. I'm part of that, and part of the initiative bringing me aboard was to get things fixed. And that's what I'm doing, about following established protocols. So, no, I was unaware that there could be any emergency declaration where I could just go out and repair restrooms, because
I mean, what I'm hearing, John, what we're seeing in
COVID-19.
Right.
This is what I'm doing. We're using other funds, Department of Interior funds, from the Land Water Conservation Fund.
Nice.
So that's not part of the CARES Act or the other funds that are available. So I'm not sure if I have the authority to go down and shut things down and just say, as people to come out and start working, because there is a bid process, and DPR simply we cut the request for proposals that we want a project started, and if it's with construction or something involving construction, it goes to Department of Public Works. Everything else, maintenance, purchase materials, and all that goes through GSA. So yeah, there are procedures that we must follow, and of course it takes time to do that. So I'm simply following proper protocols established by our local government and rules established under the fund that we're accessing, which is federal funds, to refurbish as much of the inventory within DPR's control, which is one of them are the bathrooms and restrooms, which we've been getting a lot of complaints about over the years. And while people complain when they're not working properly and they're shut down, when you shut them down to repair them, we still get complaints. So the way I look at it is, whether I start the work or not, I'm going to get complaints either way. So might as well do what's right.
Sounds like you got a problem with people complaining, John. I mean, they're going to complain because they're frustrated. I mean, this is not a new problem, but that's why they're complaining.
It's human nature. Most people want things now, and they'll get it. I think just in better condition, and hopefully some of those restrooms will start being completed within a couple of weeks, a week or so.
Right.
And we have other projects that are starting up, like the tennis courts are another one, and currently also a couple of basketball courts out
How
there.
about the pool?
Yeah.
The pool.
The pool is another one, yes. That's one of the main reasons I was brought in. Not just the pool, but even the Paseo Stadium.
Mm-hmm.
Okay, so when I came in, just like everybody else on the island, because I'm pretty new in there right now, just like everyone else, people were frustrated that our facilities were closing down because of neglect. Basically, that's what's it. And people were blaming the contractor. But I think the blame goes all around. It goes even into the parks and recreation.
Even into the former director, too, right?
Well, him and perhaps ones prior to him, because this is a long, ongoing issue. We've read about this in the papers. We've heard it on the news, and this is not something that just occurred recently.
Mm-hmm.
It's a problem that's been going on for years. And for the Ganya, the swimming pool, that pool is over 50 years old. I remember my children when I was a young man, and they were going to the pool. They were part of the Mauna Kea swim team, and we spent a lot of time there. And we've had issues back then with the pool being shut down. Now my children in their mid-40s, they have their children, my grandchildren, who are also have been using the pool, and for the most part of that time, it's shut down. So yeah, this is an ongoing problem that's been going on for years. The pool is over 50 years old. I've been told that the life expectancy of the concrete used in the pool, because it's underwater and the neglect and all that it's 50 years. And the pool is over 50 years old. I think it hit the 50-year mark last year or sometime around there.
We got a comment here, John. It took a pandemic to repair the restrooms, bottom line.
So where are we?
Yeah, I'm part of that initiative from the governor and lieutenant governor. I'm brought in because of issues like that.
The pool and the
It's my
restrooms?
job.
Well,
Yeah.
Okay, well, let's just start with the pool. Where are we with the Aganya pool?
Okay, I was trying to explain that the pool's old. It's reached its maximum lifespan. If I repair it, I can repair it. We put out bids, and the lowest bid came. It looked like before I got in, they were planning to spend about $150,000 to repair it. The lowest bid came in way over $260,000, and that's about $250,000 right there to repair a pool. And with all the people I spoke with and the reports I've read, it's going to be a temporary fix, a Band-Aid fix that could probably keep the pool running for another year or 2 years before we have to spend about the same amount of money again. And this is due to the neglect of simply not taking care of it. I mean, you could look at your own vehicle, right? You buy a vehicle, they'll tell you that it has a certain life expectancy, and by the time that's over, you buy another one. But if you take really good care of it, you could extend that life expectancy. In this case, the pool was neglected, so the life expectancy, well, if it's extended, it's simply going to be repair after repair after repair. So what I'm looking at, and I've discussed this with the governor, is to build a new pool. And because the current pool, I also looked at, okay, what if we put a liner inside and try to extend it to make it Olympic size? It's short by about, 3 to 6 inches, somewhere like that. If you cut the concrete, extend it, you have new concrete, it won't really bond with the old one. We will have cracks, we will have leaks. So I'm trying to look at what the taxpayer can get for the money that we're going to spend and get the best deal. And I believe the best deal is to build a new pool. And she would build it in where the original location is the other question. So I've been looking at multiple sites. Joe Borja of the Department of Land Management is assisting in that, in locating government property somewhere central in the part of the island where we could build a new pool. And I'm looking at, if we're going to build a new one, we might as well make an Olympic size one and go all the way. And my understanding is that to build a pool up at the northern end costs about $2.1 million. So that should be what we have to target pretty much for a pool in the central part of the island. So should we repair the old one or build a new one? I think the best thing is, why don't we just go for it and build a new one and end all these issues that have been occurring over the years with the older one, and then start with a good program of monitoring. Should we go out and contract the maintenance to the private sector? The answer is going to be yes. DPR doesn't really have much of a choice, because if you look at the history of the Department of Parks and Rec, I came from the Bradley administration back in the 80s. Now you're talking several decades later. Back then, Parks and Rec was a pretty large department within the government of Guam. Over 220, 240 employees with a budget about over $8 million. Today, and even in the 90s, where I've gone back and found actual records, it was over 202 employees with a budget about $8 million. Today, we're 43 employees with a budget of $3.6 million. So with inflation and everything, the department has been severely cut. So there's been severe issues with my predecessors of keeping the department operating because of the cutbacks. So does the Parks and Rec actually have personnel on hand to maintain the pool? The answer is going to be no. We have to seek help from outside. So we're going to be faced with, unless we hire personnel with expertise, our option is to outsource it and through contracts. Except now what I'm looking at is that we must have people on board that can better monitor these contracts, because that was the failure, was you hire someone to take care of something, and then you don't go out and verify that the actual work was done.
So John, I wanted to ask, was this we're talking about building a whole new pool now, and we still have like the Dedado pool, and I don't even think that's really old.
No, it's not. It's not. That's the story there.
Yeah, we're not even using that pool, and there were issues with that pool, and so we're talking about a new pool. Yes. We can't. We have one in Dedado that's.
We have to repair the northern pool. I wrote to the director of public works asking him to expedite that, because I want to get that one processed through. Because, like I said, DPR processed the request for, and we identified the funding. We processed the request to begin the process. But once we get to that point, Public Works takes over if it's construction. And they go out, they start the bidding process, and then they select a contractor. In the end, we get it back at DPR. So I'm not involved in that process. Currently, it is at Public Works. They are working on it.
Are we talking about the Dededo pool still?
Yes.
Okay.
Is the fix, I mean, what kind of fix is it, John? Is it a fix that's going to be so costly we might as well build a new one, or is it something
No. That pool's problem with that was neglect. So because of that, we have to repair certain items in it. I don't have the list before me. We did have a compliance issue with that I read that came out from Public Health, where Public Health shut it down. And so I looked at all the points that they made. I placed that in, and I understand we have to take care and replace some parts, like buy the salt for the filtering systems and all that. So it was basically maintenance. We got some items that we got to replace, but I don't think it's going to cost over $50,000 compared with the Hagåtña pool. So I hope to get, but I won't know the exact price till the bids come in. So we hope, and I hope that if we get that going, once we clear through Public Works, we could have everything done within a month. And the paperwork has already been worked on, so it's just a matter of getting through that process. It doesn't happen overnight. Like I said, there's a lot of issues with compliance as far as with the federal funds, and another one is meeting the deficiencies that Public Health identified.
Is it really that complicated, though, John? It kind of seems like people do it all over the island every day. They take care of their pools. Yes. I mean, we have so many examples.
Yes, if you're private, that's true. But we're working with federal funds here. It'd be great if Guam had all of this money on it in its own coffers for us to go in and abide by just simply our local rules of procurement. But we don't, and especially now that we're in this crisis, the economy took a big hit, and the Department of Parks and Rec, the main part of our budget, just like GVB, comes from the Tourist Attraction Fund. And you know where our tourists are. If we don't have tourists, we don't have money coming in, then we have difficulties of keeping our operations running. So if that doesn't occur soon, DPR's budget, if they're going to keep us operating, it's going to have to switch us over to the general fund. But currently our budget is with the Tourist Attraction Fund. Right. So there's an issue of money. So our job is to look for federal funds to take care of these projects. So I said it's a bigger picture now that we're in crisis. It would be a whole lot easier if I came in the department during regular times where you have access to operations that were shut down during this period of time. Mm-hmm. A lot of Guam was shut down. So even trying to get regular requisitions through the government has been extremely difficult because that was limited to emergency processes that dealt with the coronavirus. Right. So if I wanted to get trash bags to pick up trash, because we're constantly picking trash up in the parks, I'm running short of that. Mm-hmm. So hopefully BBMR is now up and running where they'll process our regular requisitions so we can get this all through GSA. It's not like you have your wallet, you go to the store and buy trash bags. You can do that instantly. There is a process that we work through with the government. It's not that simple. Mm-hmm. You have to understand the actual operations of the government. And while I'm new to Parks and Rec, I'm not new to government operations. Right. Mm-hmm. So knowing that, there have been procedures that we must follow. That's what I'm trying to explain is that people think that it can happen overnight. You can take the ball and start running, and you see the issues of procurement that even the governor and others have been having where people say, why don't you do this now? We need it today. Mm-hmm. If you do that...
I think, though, John, people don't want it to happen. I mean, they understand it's not going to happen overnight, but, I mean, over a month, over a year, over years. It's
I'm hoping to get that done. The Northern Pool, I'm hoping to get that done. I'm trying to push it so that we can get it done within a couple of months or so.
And then, John...
So the Northern Pool, couple of months... Hagåtña pool, forget about it because we're going to try and build a new pool.
If I'm told to repair it, I'll repair it, but it's going to cost $250,000, and I have not been given the instructions to go there. I'm looking at the other options right now, and I'm also looking at trying to obtain federal monies to do it, so that we don't have to dip into our local funds that we desperately need here. And if we bring in new federal monies, that adds to our economy. It'll be new money entering, and that would help everyone out. By how that works, right? How things start, and so that's what we're looking at, trying to find a way to help the island on top of getting these things operational. So, yeah, I know it's a controversial thing. I've been on the other side complaining, before I got in. Now that I'm in here sitting on the hot seat, it's my job to get it done and as quickly as possible.
Don't burn your dog in, John. Hey, John, I'm wondering though with the pools, right? Let's say perfect world, we did our job and they were up and running. Would that be something that would be allowed to open, given the COVID and the social distancing, in your opinion? So if the pools were up and running, could we open them today?
I don't see why not. My understanding, it's safer to be outside than it is inside. With the aerosol mist that comes out whenever we speak. That's why we must wear masks, especially when we're inside. Be outside, the wind and everything blows things away. I worry about things being left on equipment like park equipment, playground equipment, because it takes time for that to disappear. But if you're out in the grass and open and also in the water, I think that should clearly wash away the virus. Right. But I'm not an expert on that.
Right.
I've just been told from what I've been reading that it's definitely safer to be outside. And that's how come, right now we're into Core 2, and since we moved into there, people have been out and venturing into the parks a lot more. Before, it looked like a ghost town. But in the early morning and later evenings, people out there exercising, jogging, walking their dogs or whatever, and swimming. And so I see more people out there. Now that we're officially entering summer, because the school systems, they've been shut down, but many students have been on distant learning with UOG, GCC, and even GDOE. Now that we're officially in summer, I expect the parks to fill up, because there's not too many alternatives available for people right now. A lot of businesses that are geared up towards this have been shut down and are still shut down. So if the parks open up, I expect it to fill up rather quickly, and more so if we enter into Core 3. Yes.
Has there been any discussions to get out of the pool business and privatize it? It just seems like if you don't have enough staff to maintain them, and we don't really have a good track record of keeping them open. And then, just when you look at like Southern High School, I don't think that's under Parks and Recs, but that place, it's so sad that they built this beautiful pool, and I don't even think it was ever used.
You're correct. I was thinking when I first came in of looking at the pool down at Southern High. My understanding, after speaking with the engineers, is they were telling me, you think the Agania pool is in bad disrepair. They said, you don't even want to go look at that pool that was built down there. It's worse.
It's a waste of money.
I'm not sure for a fact of that, but that's what some engineers have informed me. Because I said, why can't we just go fix that one and use it as something for the community and GDOE? And they said, no, you don't really want to look at that. It's going to cost more than to repair the pool in Agania. So,
So any talks about just getting out of the pool business?
Well, that would be nice, but we live in an island. Our people, I really believe our people need to learn how to survive in the water. It's all around us. How do we train our young people to be safe? Is teach them how to swim, teach them about water safety. And it's difficult to do that in the ocean.
I'm saying the government get out of the pool business and let a private. Has there been any talks about some sort of private partnership or a private? I'm
still looking at. The government could build it, and that's what we're looking at, and it's still on the table for outsourcing the maintenance. Except, just like everybody else, when you hire somebody to do a job, you have to watch what they do to get the best out of the dollar invested. And that has been a failure on the government part, and that's what I was trying to say in the beginning, is the failure of the pool and what caused the neglect is not just the contractor. The contractor is a private business person, and their job basically is to make money. I mean, that's why you go into business in the private sector. And if you can, and some people feel that if you can get away, because you're allowed to get away with cutting corners to make that extra profit, you're going to take advantage of that. The part of us in the government is we must enforce our rules, enforce the contracts, make sure that they're following it to the letter so that the people paying for it, the taxpayer, get the best results for their investment. So should it be private built? Well, I'm not too sure how many private companies can afford to build a private pool aside from the hotels, and then the price tag for average people to use it's going to be extremely high. But if the government builds it and then uses the assistance of the private sector to run it, and then just have people in positions in the department that is overseeing it to make sure the contracts are being enforced, and everything should go well. And that's what should have happened with this last contractor. And this was hired since the previous administration and worked its way into this one. And because of that, I was brought on board, and my job's to fix that. So I'm doing my best. I've only been on board for a couple of months.
Right.
And you can see by the result of all the work that has and is taking place now. I mean, it's public knowledge. You go out to the parks and everything, and you can see what's happening. And when I say this is the lieutenant governor's project here, I was brought on board as part of that initiative to push this forward for the lieutenant governor and, of course, the governor, because they brought me on board and they said, this is what's going to happen and you're going to take care of it. So, of course, I keep them up to date on what I'm doing, and if they have any comments or recommendations, I listen to that and I try to take care of it. You know, that's my job. And what they want to do is, and I've been told by the governor that we will get the property to build in a pool. We will get the money. It will be done for me to proceed with it, but also to repair the northern pool. Now, the stadium was another issue that came up in the past, and right now a lot has been done at the stadium. It's operational, except for nighttime games. We could use it now for daytime games because I need to repair the lights. Do we have funding for that, federal funding? The answer is yes. That's going to come up soon, again, when we start repairing that. But if the word comes out that we can open gyms and get people together, we can social distance in the stand there. You know, we have a whole lot of bleachers up there, chairs, but we can only have daytime games. But as far as that, with the Sale Stadium, that's where it's at. The restrooms work. Pretty much, you go in there, you could take a shower, you could use the toilets, the teams could change and so on.
So what's the timeline to get Paseo back up and running?
Well, it's when Core 3 opens.
Okay.
And but we won't be able to do nighttime games.
Right.
Because the floodlights need to be replaced. And
so that's the only thing left on the checklist is to get the floodlights replaced.
Yeah, I like to get it painted and make it look nicer. But that's aesthetics, functionality. It's ready.
Do you have a maintenance contract for that?
No, I have my guys doing it, and they're taking care of it. I hope that I get a lot of these things done because, to be honest with you, I don't have the personnel on board to handle everything. We have over 75 parks. We have a whole bunch of other things. We also handle things in the water along the beach.
Yes, lifeguards.
And not just on land. I mean, we also have historic preservation. We have so about half of my staff is dealing with historic preservation, and that program up there at HB is federally funded. So I want to keep that one rolling and keep it moving. And we have to protect our archaeological sites. We have to protect the culture. And that's all part of that. So when people see Parks and Rec, it's not just recreation. It's a whole lot of other things.
Right.
The mandates are huge. The responsibilities are big.
Okay. And real quickly, because we're going all over the place.
Yeah, John.
What's the status of the opening of the restrooms?
Yeah, and then John also, I mean, if you knew that the parks were going to reopen and you had, all these months during the lockdown of the COVID, why wasn't more done to ensure that our people can go to the park and maybe wash their hands? I mean, because they're telling us to wash our hands, they're telling us to, do things to avoid the spread of COVID. So why didn't you foresee that we were going to open the parks and you knew that the bathrooms were going to be closed? So do we have anything there, like the portable sinks or the portable, the porta potties, anything there for people to use? And what's the status on that?
Okay, we were working fast and trying to do the best we could and trying to get it fixed before we reopened. I was not aware that the parks were going to open this early. I thought we had more time, but apparently we were able to hold the curve flat enough to allow things to open. And while I was advising the staff that I'm working with that we could open at any time, but we're expecting to follow the CDC timelines that were set, from when we go from condition 1, 2, 3, and then to 4. Sometimes things happen a little quicker. And for the good of the community, I understand why these things are happening. It's just that I was hoping to be done, and I wasn't. Now, to get the other stuff is pretty much, do I have the resources to purchase these items? The answer is no, not at the moment. If I had more time to look for it and try to identify those, perhaps I could have. But the fact is that construction did start, and we were rushing on it, trying to get things done and get things through during the actual shutdown. And we opened. We're not yet in core 3, but when we do, I hope to have this ready for that period of time, because going into where the parks are open and the restrooms are closed, that was a big issue that I was faced with. And that's how come I went out. I contacted the various media to explain what's going on and what I'm actually working on with a limited amount of staff. Because, when we went into core 2, that's when we started opening up and bringing in the other parts of government operations. And then more recently, just this week, we were told to bring in the rest. So now, believe it or not, I've been there for 2 months, and I've yet to meet all the employees. There's only 43 of them.
Did you meet your deputy director? I know he was working quarantine.
He's been in quarantine, yes, and that's also another thing. He's been up at the quarantine facility, so I was brought in, and I've been operating the department. And hopefully, he reported to me the other day that he was tested. He came out negative because I wanted to make sure that before the deputy returns to DPR that he's not infected and he won't, because I have limited staff and I must take care of these people. I depend on them a lot to get the work done. I can't afford to have any of them get sick and worse should they come down with the virus. So I require that he get tested and be cleared before he returns to work at DPR.
Oh, it wasn't a policy for them to get the deputy directors and directors to get tested. It was just something that you wanted done?
I wanted desperately for that because I do need my deputy back in the department. I do need the extra help because we are shorthanded. Like I said, I haven't had the luxury of having a deputy. I don't have a secretary. I do my typing. There's no money to hire a secretary in the department. DPR, I'm trying to explain, is bare bones.
Right. So you haven't had a deputy director since you've been there, because he's been assigned to quarantine patrol.
You got it right off the top. Yes, ma'am.
What about the grass cutting, John? I'm getting a lot of texts and comments about grass at Tapungan Park in PD, taller than a toddler. Yeah, we're seeing it. So again, I want to go back to, if you knew we're going to reopen, why wasn't more done to prepare?
Okay. I do have a contract for some grass cutting, and the contract is something that happened before my time. It's going to expire this year, September 30, but it seems like the contractor has been assigned the smaller parts down south. When we come up with a new contract, I want to have the new contract to identify and have the larger parts part of the grass cutting responsibilities. But currently, DPR, my total group within the Parks Department, are 11 people. Of that, I have 2 assigned to the cemetery, and basically it comes down to I got about 4 people cutting grass for over 70 plus parks, going north to south and all over the island, and the others involved in other things with maintenance. So, yeah, we do have a severe shortage. I'm going to acknowledge that.
So you have 4 people, staff, cutting grass, and then you have a grass cutting contract with a company that only cuts grass in the South?
You wouldn't believe it.
How much are we paying this contractor? And was that in the contract? Like, hey, you're only going to cut grass in the South?
In certain specific parks. In specific parks. This happened before my time. I looked at it and I said, "This is going to change."
What about like a multi-agency effort, John? I mean, we see like you know with the commodities where they're folding in different agencies. Have you made the ask to anybody? It's like, hey, we're drowning here. The grass is tall. We're opening the parks. Governor, can I get somebody to bush cut?
Well, we've gotten our people out there. We've been working on it, and yes, Public Works has been a great help. They help us up at the cemeteries. We work hand in hand. For example, we have the Veterans Cemetery with the Veterans Affairs Office to maintain and help their folks at the Veterans Cemetery, and they do likewise of us up at Tigua. And so, yes, we have been, we try to see it as one government, and we've reached out and we've been assisting each other wherever we can. We had Department of Agriculture. They have a program ongoing where with UOG and other areas that have come down to the Paseo at Liberty Park and removed all the trees, what they identified as rhino infected, that have to be removed. And so there are ongoing stuff like that are ongoing. So while DPR is in the situation is, yes, we've been coordinating with other departments, GVB, DPW, agriculture, and so on. But with the shutdown, this really hampered our ability, just like everybody else. I mean, if you wanted to go to a store, you couldn't go there, and if certain items just weren't available. Same in the government. Operations are shut down. Now that they're opening up, people are called in this past Monday. People even in Parks and Rec, my recreation people are coming in, and they're gearing up to hopefully that we go into Port 3 and start opening up our programs. First time I'm meeting several of those people. So like what I tried to explain earlier is that I came in during the shutdown, so while I know who they are by name and what they're supposed to do, personally I have not met them. And for a department of 43, I should have met them all on the first day. I just did not have that luxury or that opportunity.
Right. Yeah.
To do
so let's let you get off the phone and you can go meet your staff and tell them.
You got a lot of work to do.
Yeah, it sounds like we're taking up your time, John.
I'm usually at the office by this time.
Okay, so what?
I understand.
Right.
We got to let the people know out there what's going on, what are the difficulties, and how this is impacting the entire island.
Do you know how to bush cut, John?
Oh yeah.
Okay, let's go. Let's get our bush cutter. Set the example. I'm pretty sure your staff would love that.
Yeah, except I also have to work on other things like running through payroll and everything, getting them paid.
Oh, that's
and
good.
if I go out and bush cut,
right? I got it.
Which is tremendous.
Okay, John.
So okay, Chris.
Thanks,
appreciate it. Yeah.
Good morning, and I'll keep you updated as when I find out exactly when the contractors are going to complete various projects and when others are going to start.
All right.
Okay, thanks, John.
Okay.
Wash your hands.
Be safe.
Okay.
Yeah, you too. Stay safe and thanks. Bye.
Wash your hands, but not at the parks because there's no sink. We're going to play this tutorial coming up here from the Department of Labor on how you can apply, and then also we're going to get Speaker Tina Munoz-Barnes coming up in the show, and scheduled to get Mayor Paul McDonald to talk about this health insurance choice bill. Of course, Mayor McDonald and many of you guys have struggled with the big bad off-island insurance company, and I was kind of thinking about when they had that hearing with the Aetna folks, and they couldn't even answer any questions because they're headquartered in the States. So I know people are still very frustrated about that, and we'll talk about that coming up here at 7:28. Also on the way, we got Kathy Castro from the Guam Chamber. It's the KUAM News Takeover, Guam's favorite, containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 virtual Relay for Life Guam.
Be healthy. Be informed with ITD.
Calling all graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Ooh, 7:35. Containing COVID, it's the KUAM News Takeover, Guam's favorite. Good morning. And it's all proudly brought to you by the Bank of Guam, Coast 360, ITD, Ambrose Inc., and Cabo Enterprises. Let's go back to the phones we have from the Chamber of Commerce to talk reopenings and how they're going. Catherine Castro. Good morning, Catherine.
Hi, good morning.
Good morning.
Good morning, Sabrina.
Good morning.
I guess first question we would have for you is, how's the dine-in going? Are people dining in?
You know, there are some people dining in. I have been speaking with some of our restaurateurs.
Oh,
and
Catherine, can you speak up a little bit or put your mouth right
Sure.
there? Thank you.
Sure. Is this better?
Yeah, that'll do.
Okay. So I'm sorry, I'm driving. So I spoke with some of our restaurateurs and cafes, and they said that it's been, a light, but they expected that, right? I mean, there's still folks that are wary. The dine-in is still going strong, and obviously we all appreciate the support of our local community for our restaurants and cafes, and we're expecting this to be a little slow as people start to feel a little bit more comfortable about what the guidelines are and how the restaurants are handling social distancing and sanitation protocols, which is, of course, the big concern in our community.
Have you had a chance to dine in?
Not I, no.
No, not yet.
Yeah, I on Saturday I went around and I just kind of took a peek at how the parking lots were doing and what the lines were looking like at different times of the day, and it was still looking like long lines at the takeout.
Mm-hmm.
Speed trap at FD, everybody going southbound. Catherine, what about the shopping centers? How have the business been for these shopping centers?
I think that with the opening of the larger stores, it's been much better. And as you've seen in some of your local media and yourselves, you've seen the lines at, especially during the weekends, at the bigger anchor stores. So they've been doing pretty well, and I've noticed that most of the things that people are going for are, I don't know if you've noticed in the shopping, folks, but like home improvement stuff. Most of the stuff for the home. It looks like maybe people are doing fixer-upper type things, upgrading their electronics equipment.
Mm-hmm. Have you been involved with the discussions on economic recovery and the governor's panel of advisors?
Not me personally. Our chairwoman, Christine Leto,
okay.
Has been directly involved in those discussions.
Mm-hmm. Have you heard? Go ahead.
No, go ahead.
No, I was just going to follow up on on the Gita's announcement about the $20 million CARES Act funding that has been set aside for small businesses to help with their recovery, and if you've gotten any updates on how that has been going.
I haven't. I've been meaning to speak with Mel and Ricky, but I have been getting a couple of small business phone calls saying that there's been some little glitches of uploading documents. And I'm pretty sure that there were just some little bit of system glitches. Obviously, when they first opened, right, there was probably a whole bunch of people that were trying to take advantage of this opportunity. But that's all I know of so far, other than from what I've read in the media.
Do you know if anybody's gotten an actual check from the program yet, or?
No, that I don't know. I don't know, but I know of some of the other folks that have applied for other things that are very thankful for that opportunity and are utilizing it so that they can bring back their employees and get them going back to work.
We're talking about the PPP and the EIDL.
The PPP, EIDL, yes.
Okay. And out of the total membership over at the Chamber of Commerce, can you give a rough estimate on how many have taken advantage of the PPP or the EIDL? Do you guys keep track of that?
No, unfortunately, we don't, Sabrina. Yeah, so I don't have that information for you.
Okay. And so I guess what other programs are you guys working on then? I know that when when you guys you joined with the Women's Chamber of Commerce and you held a seminar with Ricky Hernandez on PCOR 2. Do you plan on holding any other similar online seminars?
Yes, those are all in the works. We're actually working on that's part of our webinar series, and then we're working on mini events that are particular to our our committee. So we've got a small business committee, a Guam Young Professionals group, a Chamber Business Women's Network, and so those are the plans for those committees, and working on virtual events for them are in the works, and we'll be rolling out information to the membership for that very soon. We're also have relaunched our Nala Bonita Guam Beautification program. As we're getting ready to open up our island for visitors, we wanted to make sure that we've cleaned our household.
Now, Gus Guam.
So we are, this is a program that we've had for a very, very long time, and it just kind of went into hiatus for a little bit. And after some discussion, I guess, with the economic group that Christine is on and some of our chamber members are on, they discussed about how, what we need to do as a community to spruce up and take care of our home, not only for our visitors, but for ourselves. So our Nala Bonita Guam program has been resurrected, and basically what that is to recognize businesses, individuals, organizations who have made a significant impact on beautification. So whether it's your building, whether it's a project or a roadside, something along those lines, we have a nomination form that's available on our website, or people can contact the Guam Chamber of Commerce, and we'd be happy to email you a nomination form. And so that's one of the things that we're working on. We're trying to help with helping to keep our island beautiful and clean. So those are the things, obviously, the Visitors Bureau and there's strategists, that are talking, and they're looking at, how can we bring businesses, how can we bring our visitors back to Guam? And the huge thing right now is feeling safe and sanitary and clean. And so that's how we have to take a look at what are the strategies that we can do as a community to put that information out there, not only for our local residents, but for the world.
Mm-hmm. And so how soon are you guys hoping to relaunch the program?
Well, we put out a notification last Friday, and so this is the first time I'm speaking about it in the media. So we've pushing out a press release later today in reference to the beautification program, and so we're looking forward to people being excited and looking at just coming together as a community and keeping our island beautiful and clean.
Mm-hmm. So it's more of the program is more of a proposal to encourage businesses to go out there and host cleanups and things like that, and then get recognition from the Chamber of Commerce? Or are you speaking about one day that everybody's going to participate in a cleanup?
So this is an ongoing program. So this is to recognize anybody that. So for example, if there's a couple that I remember, former speaker Ampinko, God rest his soul, him and his wife would have their morning walks, and they would bring their trash bags and pick up trash along their morning routes, and they would do that for years. And so someone nominated them because they helped keep their part of their world in that area clean of trash, debris, things like that. So they were nominated with a La Bonita Guam Award. It's just your everyday person who is doing their part in keeping our island clean and keeping our island beautiful. Whether it's a building, or whether it's somebody that's taken an eyesore and has made it into, something that has really good curb appeal, or an organization that is supporting cleanup projects, and they've been doing it for a long time, and they haven't had any recognition for it. We just want to encourage people to do their part in beautification efforts, and have them be recognized for doing that.
We just reopened dine-in service. The Chamber of Commerce has been involved with, businesses that want to reopen, but they have to turn in plans, as I understand. What businesses have reached out to the Chamber of Commerce that want to reopen but haven't been able to?
So we're obviously very, very concerned about these businesses, right? I mean, every time restrictions are talked about being lifted, we're really pleading and doing our best to make the case for opening of all of our businesses. But the businesses that right now that have not been allowed to open are the marine sports businesses, our playground, our amusement businesses, and those places that have any type of amusement, like Underwater World or Tagata or Sky Zone, those types of businesses where I guess the concern would be because it's people would congregate and be together, but because of the lifting of the restrictions recently for social gatherings, we're hopeful that the restrictions would be lifted for these businesses as well very soon.
You're hearing that they will be.
We're hopeful, yeah, because as long as again with keeping the positive cases as low as possible for the length of time that we've been doing that, we're feeling very positive that more and more businesses will be open in a shorter amount of time. So yeah. So for a while, the training groups, the dance studios, they were itching to open, and for their credit, for everybody's credit, they were all great about submitting their guidelines, submitting their sanitation protocols. I think the business community has come forth and has done such a terrific job in just coming together and understanding the situation, and nobody really wants to be that company where there was a COVID outbreak. You know what I mean?
Yeah.
So we know. I personally feel confident in our local businesses that they are doing the best that they can to follow all of the guidelines and the expectations for sanitation protocol.
So no Chuck E. Cheese, huh?
Oh, man, that's so sad. I don't know what to say.
I mean, what about those business? I mean, that's a business where you just go in, everyone's touching everything, right? So, what other businesses that fall in that category? And I'm thinking like the Playports or the Lollipops or whatever. Are these like kind of the last of the businesses that we would like? Are they in the category with daycares and schools?
I'm thinking that that's where they're coming from, right? Because children, what can you know, they don't understand social distancing.
Right.
They're all about being social, right? So and I understand where, you know, public health and the governor is coming from in reference to that. But I also feel that that businesses also are responsible, and if they have there's been so much work in developing guidelines and sanitation protocols to be safe, not only for themselves but for customers. So I feel like there should be a level of trust, and you know, we've all been through this, and we're all understanding that this is very, very important. But we do have an economic crisis, and we need to do our best to get our people employed and feeling comfortable in that they are earning a living.
I know there was one question that was brought up during the press conference. I think it was last week. One of the reporters was asking about game rooms because they had heard that some game rooms were open, and then the governor, I believe she said that, you know, it wasn't really on the list, and that they really shouldn't be open at this point. Have you heard anything about whether game rooms have been allowed to open?
No, I haven't. That's, you know, I'm sorry, I didn't even think about game rooms. I've been mostly working with, you know, the folks that have been waiting to open, right? The gyms, the CrossFits, the dance studios.
What about the jiu-jitsu academies?
Yeah.
Have you heard anything about that? I got a kid that's like, Mom, I want to go to jiu-jitsu.
I got about 10 pounds of Chuck E. Cheese tickets. I'm trying to figure out what I'm going to do with.
Well, I think, you know, I know that a lot of those folks, right, if you do the one-on-one appointments, that's what's been really good about our business community, is that they've been really, really creative. And if they can, and if they have the economic means to do it, they're doing it. It's been difficult because if you don't have money to operate, then you can't open your doors, right? And so, and if there is a way that businesses can work virtually, if they can do one-on-one appointments while still following social distancing and sanitation protocols, they're allowed to do that.
You know, I wanted to ask about the Women's Chamber of Commerce. There were these public hearings last week, or Monday, I believe. No, last week, on the double pay issue. And the Women's Chamber of Commerce came out vehemently opposed to any sort of double pay to these frontline workers. And so is the Chamber of Commerce also taking a similar position? Or did they sign on to the letter with the Women's Chamber of Commerce?
The Guam Chamber of Commerce has not taken an official position on these matters because they're specifically dealing with government of Guam employees. So we've not taken a position on those particular issues officially.
And what about, okay, so no position on that, but what about working with the Department of Labor and the PUA online application form? Is that something that the Chamber and your members are doing to work with DOL? Because we understand that the online application form is cumbersome.
Well, we have been working with DOL in pushing out the information to the business community, and I have personally helped a few people register their individual employees to get them online, and I know that they're just kind of going through it myself with these individuals. They could be cumbersome because if you're not tech savvy, it could be a little bit of an issue. If you do not have a computer, it could be a little bit of an issue. Although it is mobile friendly, I've looked at it and I've seen how you can utilize your mobile device. But if you don't have your documents in your mobile device, or if your mobile device cannot take a picture to upload, then you're a little bit in a bind. Also, another thing that I've noticed, that if you're a permanent resident, if you're not a U.S. citizen, and if you're a permanent resident, you will need to have your green card documentation or information available, because that needs to be logged into this program or this system.
Well, so we actually have Dave on the line, De La Sola, Catherine, so we'll go in with him on this process and any update he might have. Well, thank you for your time, Catherine. Always good to check in with you. We try and do it every week to find out where we're at with the chamber.
Thank you so much. Have a good one, guys.
You too. Take care.
Wash your hands. Watch the road.
All right. Bye now.
Okay, bye. Thank you. 7:56. Let's just go over to Dave right now, because I know you definitely got a lot on your plate. Our congratulations in order for the launching of the website, Dave. Has anything changed from yesterday at the press conference, where I noticed your optimism was a little bit tempered by your statements about the application and the site still having these bugs and glitches?
Man, I'm a realist. I don't want to say that everything is great and rosy when people are still having problems. And, a lot of people have successfully submitted claims, and they've been congratulated, sending me messages. It's been easy and great. And then there's always some people that are also sending me that they're having problems. So I'm happy that it's up and that we're starting to accept applications, and we're moving quickly with the payment side. So that'll be, I feel, solved very quickly. And we're putting in some extra integrity measures into the system to make sure that we try to curtail any of the fraud and the tens of millions of dollars that are being taken from in the States. So, USDOL has got some lessons learned, and they are asking us to put in some integrity into the payment side. And we're working with the software vendor, and they got some ideas. So we're putting in some added measures as we're building up the payments. And I hope that, these internet fraud rings are made up of pretty smart people that are, all they do for a living is try to steal data and steal dollars. And I'm hoping that we can keep them at bay, and we can just get all the money that Guam is given to the people of Guam.
Have you already seen people trying to, infiltrate the local program?
We are just starting to. Right now, we're just standing up GCC, getting that whole processing, the hotline and the phone numbers and call-in centers in place. We're trying to vet through the system all the bugs and the kinks, and making sure that the list, that list gets up so that the programmer can fix immediately. Mm-hmm. So we are, we're not ready to go in and look. We do have a couple things in there that we've seen, like we're flagging anything that looks off island, and especially foreign, and we can pull those lists out. We just got to go through to see if those are actually people that happen to be on Guam but moved to those foreign places. We just got to vet them out. So before any checks get cut, we will definitely go in and do a cursory look at some of these things, and that's so we can just call up different methods of all the off-island banks or all the people with foreign addresses, and we can get those lists printed out, and then we can kind of vet them and their companies if they're legal companies here on Guam. So we're trying to do that due diligence, balance that out. We're trying to get ready to help the people that have had problems with the site so that we can go in and correct it so that they can continue on with the application. And like I said, we're continuously, DOA is moving with the check writing, working with the vendor. They're moving very quickly, and everything is starting to fall into place. So I feel good that we're moving forward quickly, and everything is moving. It's just I'm so happy that I was got GCC now, and I can call everybody and start training them. That quarantine has always been a thorn in my side.
Right. I heard you mention it during the press conference yesterday, Dave. Yeah. Did you get in trouble for that? Did you get in trouble for that?
No. I try to, I only speak the truth, my friend.
I know. Well, Dave, we're against the top of the hour, and we're going to play the tutorial video. Is there anything in closing that you want to add here before we let you go? Because I know we want to let you get to work.
Yes, please take a couple more days. Let us get all those support mechanisms in place, and we're going to get a good tutorial step by step out there to help guide you. You're not going to get the money if you wait any faster than if you wait a couple days, and make sure that you get a clean application. And go out and get your bank account so you can do those EFTs so that we can get that money to you quicker. So let us get caught up with the system, and let us get it clean and fixed and all working smoothly. All I'm asking is for a couple days, and you can go in and at least register your name and get a password, and we can and then stand by for hopefully a clean experience. I appreciate your time and effort, Sabrina and Chris.
Thanks, Dave. Wash your hands. Right.
Take care.
Okay. 8:01. So we're gonna actually play this tutorial that they kind of unveiled it during the press conference here, and as we heard from some of our own people, this process to apply very, what was the word you used?
Cumbersome.
Cumbersome. Wow, that's the word for the day.
That's a Jason Salas word.
It's very cumbersome, and you actually have to apply for every week that you're out of work. So if you were out of work the whole time, then yeah, I think you would probably copy and paste a lot of it. But let's say you were out of work and then they brought you back with reduced hours. That's obviously going to have to be reflected in your application process. So again, this video courtesy the Department of Labor, and it is a tutorial on how to apply for the pandemic unemployment assistance. And again, we're KUAM FM in Agutnia, Guam. The KUAM News Takeover, Guam's favorite. It is containing COVID. Good morning.
Ha'afade. When it comes to applying for unemployment benefits as it relates to the Pandemic Unemployment Assistance and Federal Pandemic Unemployment Compensation programs, the first thing you'll need to do is create an account and register on HireGuam.com. Utilizing this button rather than the Not Registered button at the upper right login box will ease the pool registration process as it was built specifically for the pool program. The first page you'll see is the welcome page that explains the pool program and the 10 scenarios of eligibility that caused unemployment. Read through it entirely, and if any pertain to you, click Next. Input your social security number and then re-enter to confirm. Notice at the top of the page, the eligibility section is completed and the registration process begins. In order to complete your registration process, you will be asked to provide the following: a username and password and select a security question, an email address, or if you don't have one, you will be required to create one with the link provided, your residential and mailing address if different, your preferred notification method to receive benefit notices and updates, any prior military or current military service, education, occupation, your preferred payment method, such as direct deposit or paper check. Now, if you opt for direct deposit, you will need to supply your bank account and routing number. And since these benefits are taxable, whether or not you would like your taxes withheld. When you see the page notifying you to proceed to make your PUA claim, you have completed the registration process and may continue to the work history portion of the claims process. Input your last employer data, job title, and employment information. When the system prompts you to enter your last day worked, make sure you enter the date in which your employment status was directly affected by COVID-19. For example, if you were furloughed on April 1st, 2020, but have since returned to work, you will enter April 1st and not yesterday. Complete the rest of your work history information and add as many past employers as needed. Once completed, you will be required to certify that all information is true and correct, that you are responsible to keep informed of program benefits and reading program material, and that you acknowledge that any false statements are punishable by law and could result in a fine, imprisonment, restitution, and a loss of future benefits. Read through PUA's to-do list and take note of the following. Immediately file your weekly claim. Report all income for the week to include tips, commissions, and gratuities, even if you have not yet been paid. If you return to your normal pre-pandemic work hours or return to work and make over $494, you must stop filing a weekly claim. You must be able and available for work. If you are offered your job back and refuse for a non-COVID related reason, you are no longer eligible to receive PUA benefits. And at PCOR 3, you must look for work by contacting at least 3 different employers about job openings. Be sure to upload a valid government-issued ID and supporting documents to strengthen your claim. Congratulations! You have completed the PUA claim filing process. It's time to file your weekly claim. Click on the File Your Weekly Claim button to proceed. Read through the explanation of the weekly certification process and advisories before proceeding. Notice that the weekly certification process begins the week in which you claimed as your last day of work. Answer each page honestly and input additional information as required. However, if you have since returned to work, be sure that on the weekly claim of the day you returned, you adjust your weekly earnings accordingly. Congratulations! You have filed your weekly claim. Make sure you file for all previous weeks you were affected to present. Now continue to file every week thereafter to receive unemployment benefits for those weeks. For more information on how the Guam Department of Labor can assist you, visit our website at dol.guam.gov.
Panogit sa moru purita nonda kantai mantunat nyagi toru ilugar para ion ra para Abibay islasen para honra, para gloria. Abibay islasen para Gitodui tempui pas para hita dan gini langit na bendisyon Kontray peligro na fansafuham Deus protege Island Guam Kontray peligro na fansafuham Deus protege Island Guam sempre uma disponi ai fine natin ngo adingu sinana sagwa likidu na kaduku matagui família ku tutungu manubatu sinana hatagi loti huoski zabenti
Super close.
Hey, good morning. 8:11. Thanks for joining the show. It's KUAM FM, Agotnia, Guam, the KUAM News takeover of Guam's favorite. Good morning, Guam. To our viewers on KUAM TV 11, thank you for joining us as we always throw the back half of the Containing COVID show onto the TV for our, especially for my Monomco viewers who, some of them I just talked to during the break, just finished going to Mass in Asin in this case, and now drinking their coffee and listening to the show. So good morning and thank you guys. Again, KUAM.com, there's a live stream, there's an audio stream, Docomo Channel 10, and also you can catch us right here on the radio, 93.9 FM, and last but not least, on the Edward R. Murrow Award-winning social media networks at KUAM, on our Facebook Live. Good morning. We're getting excited back there with Joe, sir. And as we always do at the 6 o'clock hour, the 8 o'clock hour, we do a dive into the day's COVID-19 headlines from the KUAM News team with the latest. Good morning, Sabrina Salas-Mantanani.
Today, good morning, everyone. Following 2 additional cases that were reported Monday, the number of COVID cases on Guam stands at 175. As for testing conducted yesterday, 27 samples were run through Public Health's lab and 0 returned positive. Again, those are only for samples from Public Health's lab. They do not include results from other labs at GMH, GRMC, and DLS. Governor Lulian Guerrero signed another executive order, this time to officially launch the Pandemic Unemployment Assistance and Federal Pandemic Unemployment Compensation Programs. But officials say they're still working out the kinks and asking for applicants' patience. Nestor Lecanto reports.
We have done over the weekend some testing, and now we are ready to move it forward. There are going to be some glitches, and we ask for your patience when that happens.
The Governor and Labor Director David De La Sola emphasized that not only is it a newly built computer program, an unemployment program in and of itself is new to Guam. So far, more than 1,100 employers have submitted data showing more than 21,000 employees have been affected. GCC has offered to serve as the processing and call-in center to assist applicants. President Dr. Mary Okada.
With the help of our MIS team, and so they were able to set up a total of about 80 computers that were redirected from other areas of the campus.
De La Sola acknowledges that the application process will be one of the biggest choke points, and so the more computer assistance applicants can get, the better. That's why De La Sola says,
once we stand up the processing center and the training center, we can start calling the employers in and start training them so that they can better prepare their employees.
He says the program will be very strict, so getting the application right the first time will be crucial, so not to delay the processing.
You can't go back and change it because you can't go around and just keep changing and how much money you're going to be getting. It is something that has to be staff driven because of the this is a UI program, and it's very rigid as far as making changes once you've checked off something and then you submit
By
it.
regulation,
Accepted applications must be paid within
21
21 days, but officials say they hope to make the payouts sooner than that. For Guam's News Network, I'm Nestor Lecanto.
Process is currently only available online. GDOL has signed a memorandum of agreement with GCC to stand up a processing center on the campus for those without internet access. Once the processing center is open, individuals can make an appointment and receive help with their applications. More information will be provided once available. Now, for inquiries, you can call 735-0527 through 32, or you can email PUA, P-U-A, hotline@dol.guam.gov. The governor, in the meantime, also signed another executive order relative to launching the Guam Small Business Pandemic Assistance Grant Program. As reported, a total of $20 million in CARES Act funding was directed to Guam's small businesses who've suffered financial hardship as a result of COVID-19 due to business closure, reduced consumer spending, and a decline in visitor arrivals. GITA is overseeing that program. For a list of eligibility requirements, you can visit investguam.com/smallbusiness. Applications are being accepted via email until the $20 million in funding set aside under the CARES Act is exhausted, or until December 30th, whichever comes first. Governor Leon Guerrero stands by the statement read during a recent oversight hearing by her legal counsel, Hai Hin, regarding Guam Homeland Security's involvement with the procurement of the first round of quarantine facilities. That statement essentially was that the HSA, Tim Uggan, dropped the ball, so the governor instructed the legal counsel to take over the handling of procurement. Although Lieutenant Governor Josh Tenorio said Uggan told him that he was not involved with procurement, the governor during a press briefing said this was a responsibility of the agency and Homeland was the lead. Here's more as Adriana Cotero asked the governor about the situation.
I wanted to go back to an oversight hearing, Governor, that happened a couple weeks ago. It was in regards to the first wave of quarantine facilities, and it was done in an effort to understand procurement details. Your legal counsel, Hai Kun, had read a statement permitted by you to the Guam lawmakers that indicated that Homeland Security Advisor Tim Uggan had essentially dropped the ball on procurement for the facilities, and then at your instruction, your legal counsel took over. But since that hearing, Uggan has reached out to the minority leaders, Senator Tello-Taigui, even the lieutenant governor, saying that this is not true. And the lieutenant governor telling KUAM this morning on our I-94 FM containing COVID interactive weekday talk show, which can be heard now and streamed on KUAM's Facebook and YouTube, which I recommend all listen to. But Lieutenant Governor explaining how he received messages from Uggan over the weekend saying that he was not involved and not instructed to do any procurement. So it's still a little unclear, and I was wondering if you could please just clarify if he was involved or not at that time, and who was in charge of the procurement for the GovGuam quarantine facilities. Can you confirm if it was Tim Uggan?
So the purchasing or the procurement of the facilities, the quarantine, safe haven, and so forth is a Homeland Security responsibility. And when we started having these cases and we saw that there was the need to quarantine travelers from outside because the contacts source for these positive cases were from the outside. The procurement started with the Homeland Security. The involvement of the legal counsel was to negotiate the terms and conditions, and he did that. However, I felt that it was not going as fast as it should be. Therefore, I instructed the legal counsel to quickly purchase these services and to quickly come up with the negotiations, the terms and conditions. And that's what happened.
So, okay, just to clarify though, HSA is who was first in charge. correct?
It is
It's
by,
under that for
yes,
procurement.
by the,
Okay.
I think it's our pandemic plan, or by just the Homeland Security being the individual entity that's in charge of disasters and in charge of crisis and disasters. They are the lead agency. They're the lead agency for the logistics, the procurement, the supplies, together with the Office of Civil Defense, just like we do when there is a typhoon.
Well, okay. So then before I get to my next question, if I could just ask you then, what's your response to Tim Uggan saying that he wasn't involved or didn't have a hand in any of this?
I can't speak for him, and I don't know what happened, what the conversations were with you guys. But again, the Homeland Security was the lead agency. It was not moving as fast as it should be, at least to my expectations. And that's why I instructed the legal team to continue on with the negotiations so we can move on and get the facilities.
As reported, Minority Leader Senator Tello Taitigui also told KUAM that the Homeland Security Advisor Tim Uggan also reached out to her following that oversight hearing, saying his statement was untrue. And this just in from Guam Homeland Security Civil Defense that they, along with U.S. Naval Base Guam, will be conducting routine testing of the vital communication and advanced warning system sirens. Today at 3:15 in the afternoon, they will test 19 all hazards alert warning system sirens in conjunction with Naval Base Guam monthly routine testing of the giant voice sirens. Again, that is at 3:15 this afternoon, so do not be alarmed. They're finally home. On Monday morning, the Guam National Guard began coordinating the release of returning residents who were under quarantine at various hotels. Guard spokesperson Mark Scott says as of noon Monday, a total of 73 people were processed. 31 were from the Grand Plaza, 25 from Wyndham, and 17 from Garden Court. This follows the governor's announcement last week, giving them the option of staying at a government facility or going home. The Guard assisted with transport and traffic management. Occupants could also arrange for personal transportation. As we reported, returning Guam residents will now be allowed to home quarantine instead of being forced to stay in government quarantine facilities. They must provide proof of residency upon arrival at the airport. The Guam Police Department launching a death investigation after a man was found lifeless Sunday night along Marine Corps Drive by Wise Owl Veterinarian Clinic in Tamuning. Several island residents gathering at the ITC intersection in Tamuning to stand in solidarity for the Black Lives Matter movement Monday afternoon. Racial tensions have risen around the United States following the death of George Floyd on May 25th. Floyd died while handcuffed and restrained in Minneapolis by police officer Derek Chauvin, who kept his knee on Floyd's neck throughout the incident. Another protest is scheduled for Friday at the ITC intersection starting at 4 o'clock in the afternoon. In national news, President Trump is taking new steps to deal with the protests which have rocked the nation. Some of those even happened just yards away from his front door. Natalie Brand has more details from Washington, D.C.
Graffiti on the Lincoln Memorial and glass on the sidewalk show just some of the damage from violent protests overnight. Washington, D.C. Mayor Muriel Bowser toured the city this morning.
I'm very angry that people would destroy their own city, or people who are come here and destroy our city.
The demonstrations in the nation's capital were peaceful throughout the day as thousands marched against racial injustice in America. But some began looting and damaging buildings after the sun went down.
All of us need to work to make sure that we stop destruction, but we are focused on what we need to do to change our country.
Some of the damage includes a fire in the basement of the historic St. John's Church near Lafayette Square, just across from the White House. Every president since James Madison has attended a service here. During a conference call Monday, President Trump called Governors weak for their response to protesters.
We're strongly looking for arrests. You have to get much tougher. You're going to get over it. You have to dominate. If you don't dominate, you're wasting your time. They're going to run over you. You're going to look like a punching jerk.
In Delaware, former Vice President Joe Biden met with African American leaders to talk about how to diffuse tension.
Everybody is afraid. Everybody's angry. Unfortunately, we have to do the country together.
The presumptive Democratic nominee said if elected, he would form a police oversight board in his first 100 days in office. Natalie Brandt, CBS News, Washington.
An important reminder from the Guam Bankers Association, which is encouraging residents who plan to file for PUA to consider opting for direct deposit. You're urged to take the following steps: open a deposit account with your preferred bank, collect necessary information, be prepared to provide your account number and your bank's routing number, and visit Guam DOL's online portal, hireguam.com, to apply for assistance. And that is your Banking 671 report, brought to you by the Bank of Guam and Coast 360. Chris.
Thank you, Bree. Let's go to the phones where we have the director of Rev and Tax standing by. Good morning, Daphne.
Hi, good morning, Sabrina. Hi, good morning, Chris.
Hi.
Morning. Just wanted to get you on to get an update. So we'll just give you the floor. Just go ahead and tell us where we are with the EIPs and all the other types of checks, payments, and services that you guys are offering at Rev and Tax.
Okay, sure. So in the last week, we did do a release on just giving everyone an update on where we are with the EIP payments. And so as of May 28th, we processed and transmitted our most current batch, which was about $4.7 million. So to date, well, after April, of course, we received the approval of our EIP implementation plan, and then that was May 6th when we got monies right after that, right after we received the approval. So we cut checks on May 10, 11, 13, 19, and 28. We cut a total of about, in the month of May, I believe $107 million, and altogether about $117.9 million so far. And of course, the estimate that we have is about $134.8 million. That again, based on the information that we had, and that was what was approved by the IRS and the Treasury. So, we've paid out about 87% of what we had estimated, and we're excited about that. I know. I've met people who have received their payments, and again, as we had worked on this program, the most important thing, and we talk about the pillar of the CARES Act that we have been really leaning on, which is the making sure that payments are made out to our people as soon as possible, and so that's what we work to do. And so now, of course, we have our customer center, or call center, that people can call into, and we do have high call volumes. Our team's working to get to calls as quickly as they can, and to get back to taxpayers as well, as they email our Guam EIP at revtax.guam.gov email address. And so I just want to thank everybody as well for being patient. We're continuing to work to make payments. I was just talking with our taxpayer services administrator earlier, and so of course, now we only have probably around $17 million left in terms of, again, what we had estimated we would be paying out. And we're going to be making sure that we make payments regularly. We're targeting weekly, bi-weekly, again, based on whatever it is that we have, and we're going to make sure we get these out to our people. We have, based on the CARES Act, we have all the way up until December 31, 2020 to get payments out for those people who file a return, or for the people who file an EIP NF form. Now, if for anybody who is not able to get the payments before December 31, 2020, they are also going to be able to, if they're eligible, file for it when they do file their 2020 income tax return in 2021. So again, I know there's a lot of questions and concerns that DRT is not paying out EIP anymore. We're continuing to pay out. We just have paid out the bulk of it, as we, had indicated that we wanted to. And so that's really why now you're seeing the payments slow down. And again, that's because, almost 90% of what we had estimated has been paid out already. But we're going to continue to pay those. And we thank our people again for all of their patience. And, we're going to continue to do our best to serve our people. And other news, as you know, we've been open for about the last 2 weeks, and we've been kind of working our lines out here. In the first week, we had GPD and the National Guard with us, and the second week we had just the National Guard, because also GPD, I believe they had other things they had to assist with. So in this last week, the National Guard, that was the last week the National Guard was with us. So our team has been operating, doing cones, and just trying to help with traffic and making sure that, our people as they come in, our customers as they come in, are serviced properly. And so that's happening. We do not open our parking lot until 7 a.m. Just so you know, I know as you come up, is this Route 16, you may see a line of cars in the morning. We had, at the recommendation of GPD and our National Guard, We don't open our parking lot until around 7, and so that way we can make sure that we set up our parking lot properly and we have, proper flow so that we can make sure people are safe. We also had an incident in this last week where, as an accommodation for people who come, so that, of course, we want to make sure it's difficult already for people who are standing out in the front of our building because it's hot and it could be rainy. So we had canopies put out. We actually had an incident where a couple of our canopies were stolen in this last week. So we are continuing to try to make sure that our people are taken care of, and that's very critical. But so we've actually had to take some additional security measures to lock up our parking area and to make sure again that we provide some deterrence. Because, of course, we did borrow canopies from our mayor's offices and our National Guard. And again, we want to make sure we take care of our people. So we're constantly looking at, how we can continue to service. Obviously, we're in this new normal, and, the idea of making sure that our people, our customers, our people that we're servicing here in our office are taken care of, and that they're not standing out in the rain or standing out where it's really, really hot. We're trying to determine how we're going to move forward, because obviously to have canopies out here for extended period of time is not going to perhaps be feasible. So there are things that we're talking about that, we will not take them down until we're able to get some more kind of permanent type of solution. But in the meantime, so if you notice, I think one of our canopies on the right side, and there was one probably perhaps in the middle, that when we came in one morning, I was asked if I had known that they were going to be taken, and they weren't. I did not know, and we found out later that they actually had been stolen. So, and of course that's theft of government property, and we contacted GPD as soon as we found out that happened. I'm going to thank GPD as well. GPD and our Guam Airport Police are assisting us as well with security up here, although they're not manning our office, like we have had GPD here with us. They are making sure that they keep us on their, as they do their patrols, that they're making sure that they, come by our office and ensure that we are safe. And they're always, again, very making sure that they're available for us as we need them. So those are kind of the things that have been happening in our office. And, again, we're continuing to try to service our people. Service for our people has been very important. And I know, Chris and Sabrina, a lot of your listeners have had questions. And, again, I recommend that for people who do have questions, they try to contact us, and our email addresses, and also our customer call center. Another piece of, I guess, in relation to the EIP as well, I wanted to make sure, because we had a call with the IRS just recently, a different branch of the IRS, to address some of the phishing scams that people may be come across. And so just as a reminder, to our people, just to be careful, because, Reverend Taxley will not call you. We generally will not call you. So if you have any concerns that you may be called by somebody, or you're receiving an email that is not legitimate, we have our call center numbers. People also have our official email addresses, so they can contact us at our official numbers and email addresses. And just be mindful, that there are a lot of phishing scams, and whenever there's so much money that's involved, that people, there are people who are attempting to defraud others. So just be careful about that. And that was something that was very important that fell out of the conversation. And one last thing, which I think is really important, is for our Social Security and our veterans disability recipients. I know that has been a huge question, and with regards to Social Security and veterans disability, or our VA, there were, I think, in the last couple of weeks, some notices that came out of Social Security, and also I think of the VA, regarding EIP and EIP to Social Security and veterans disability recipients that will be coming out in the month of June. So just to kind of recap what has happened, after, as a result of our discussions with the IRS, and after we had finalized our implementation plan, the IRS and the Treasury, the direction to Rev and Tax was that, Rev and Tax would be paying out all of our Guam residents, including the Social Security and veterans disability recipients, and that continues to stand. In the beginning, though, we continue to ask for our Social Security recipients and our veterans disability recipients, as we had indicated in our earlier releases, to continue to, if they have not already filed a return for, because they either are not required to because they only receive Social Security or they don't have enough income to file, that they file an EIPNF. So, if again, we're still continuing to take the position that our Social Security and our Veterans Disability recipients, again, if they have not already filed a return and have not received their EIP payments because they have not filed returns, so please do so. And that's the position we have. We've been communicating with the IRS on this issue, and we want to make sure that all of our people get these monies as soon as possible. So for those individuals who perhaps have been waiting because, there has been some releases from the Social Security Administration and from also the Veterans Administration, the position that Rev and Tax is taking at this time is that in order for you to be able to be in our system, we're highly recommending that, as we had indicated in our earlier release, that you just go ahead and file with us at this time. And if there's any updates, we will definitely let our people know.
Real quickly, Daphne, May 6th, we got the $107 million for the EIP, but the total was $134 million. Did we ever receive the remaining balance of that to pay out EIP?
Well, so we did. So after we received the first monies back in May 6th and then started paying out, because we had paid about, I think, within 2 days, 75, and then so the 10, 11, and 13th, by the time we finished those payments, that was already almost $96 million. And so in that week, or actually maybe toward the end of the week, we had already at Rev and Tax begun discussions with the IRS and the Treasury regarding the payment of the additional monies. And so by the end of the following week, the week before the 19th, because we did receive about $24.1 million on May 19th, the week before, we were already communicating actively with them, making sure that we get the additional monies. Up front, we only got about 80% of the estimate, and, we had advised that we believed that it was important that we got the full amount. We haven't received the full amount yet. I believe there's just a couple of $1 million left that we have not received, but we received the majority of the money. So we actually did receive an additional $24.1 million, and that was on May 19 that we got confirmation from DOA that we received those monies.
Okay. And also, I know child support that was withheld. Do you have a total amount on how much in child support was withheld? And did that go to the AG's office? I don't know how much child support was withheld. I suppose that's something we can get information on. But with regards to the way that this happens is, of course, when we process checks, we process them net. And so that's why, like, for example, for an individual who may have, who should receive $1,200, and if they had $100 in child support that they would have received, they would get, they would have gotten $1,100. So the process that we follow for EIP payments and garnishment for child support is the same process that we normally follow, where we basically at the Rev and Tax side just cut the net check amount and then, of course, provide a report on the child support. Child support listing information goes over to DOA, and then that gets transmitted via the usual route. So I don't know how much in child support was withheld, but we make sure that those get done every check run. Last time we spoke, you were talking about how your staff was close to implementing a local version of the IRS's Get My Payment program. Where are we with that?
Okay, so I was hoping that we would actually have released it in the last week, and we're a little bit delayed on it. We're in the final stages of testing it, and so Sabrina, I was testing it last week, and as we were testing in the end of the week, we're coming up with some issues that I wanted to make sure we addressed before we had rolled it out. But we're I'd like to say 98% ready.
Oh, wow.
We're really, really ready. We actually already have the media release ready for it. We're just, again, in the final phases of testing, and there was a few items that we wanted to make sure that we addressed. Again, there's always security issues and those types of things. We want to make sure before we roll anything out that we feel confident and comfortable that when people access, they're really only accessing, the information that they are authorized to access. So that was one of the primary considerations that we had, and which we're working to address, and which I've been talking with my team about. But we're so close. Again, our media release is already ready. It's just making sure that we fine-tune some of it, and only because, again, this is the first time we're rolling out such thing, and it's actually really exciting. Our team is excited, and most especially on our customer service side, and because this will definitely help alleviate some of the questions that we were seeing. But we're so close to releasing it. I can see the finish line, but we're not exactly there.
All right. Well,
All right,
I know
yeah.
you're busy, so we're going to let you go. Thank you so much for making time for us.
Oh, Sabrina and Chris, thank you. And thank you for always being so supportive of us. And thank you to the listeners. And again, if they have questions, you know what? Chris and Sabrina are great at communicating those questions to me. I'm sorry, I'm talking to the listeners. So please continue to communicate your questions, concerns to, Chris and Sabrina. They communicate them to me, and that way we can make sure that we continue to serve our people, the best that we can. And again, thank you to our people, and thank you to Chris and Sabrina and to your stations for making sure that you get us out. And congratulations on your Edward R. Murrow Award for sure. Because I actually looked it up, and it's great. It's a great honor, and I wanted to just make sure I said congratulations to you on that.
Thank you. Wow,
Thank
Dad.
you.
Have a great day.
You too.
Wash
Yeah,
your
they
hands.
stole the canopy?
Even the canopy you guys will steal? Oh, my goodness.
Man. So where are we going? We're going to the Guam Memorial Hospital, hopefully. Yeah, so I wanted to talk about that Get My Payment program. It is so cool because you can go onto the IRS website, and she's trying to implement it locally, but you can go onto the IRS website and you can actually check the status of your stimulus check. I have family in Las Vegas, and that's what they did because they were wondering what's up with their check, and all they did was they filled out just a couple of just a little information on the IRS website, and it told them when their check was actually going to be mailed out. And lo and behold, my parents got it, their stimulus check, when the IRS portal said that they were going to receive it. So it's really cool when Revenue Tax finally implements this program, and as Daphne said, they're 98%. She can see the light at the end of the
finish
tunnel.
line.
Yeah.
That's when you got to dig deep and you just,
And she's got the press release ready to go, and so...
That's interesting. I guess they didn't go the Department of Labor route where they're just like gunning and put the thing out. They're actually doing... I wanted to say something, but she was in a
They're
hurry.
actually testing it? Yeah.
Yeah, so they're
Well,
actually
this is not
testing it
as
and making
probably
sure it
intense.
works. You're
Yeah.
right. It's not as in demand as the labor.
Cumbersome.
Right. 8:41. Let's go over to the Guam Memorial Hospital with Administrator Lillian Posadas. Good morning, Lillian. Thanks for joining us.
Good morning, Chris. Good morning, Sabrina.
Good morning.
Guam.
It's been a while.
Yeah, we just get right into it. This is something we're talking about with Dr. Maglotnia from Public Health, and asking you about there was a 12-year-old boy who had passed. We had got the tip that it was from COVID. I had asked you. You said it wasn't COVID, but then you told us that the child was treated in the COVID care unit, and then we also had got some tips that the death certificate had said COVID, and I spoke to the doctor who we had heard signed off on the cause of death yesterday. He informed me that it was resolved, and I'm assuming that we have changed the death certificate, which, when we talked to Dr. Maglotnia yesterday at Public Health, she did say that wasn't entirely uncommon, that type of thing has been done before. But, I mean, it just seems, especially, feeling for the family, I mean, imagine them being told it's COVID and it's not COVID. I can't even imagine what they're going through. So I really wanted to bring you on. And I thank you for coming on because, I mean, you actually called me to sort all this out. So can we do that, Lillian?
Sure, absolutely.
Okay, so go ahead. Just take us to the beginning.
Okay, yeah. From the beginning where you texted me that you received a tip that a 12-year-old boy passed away and it was COVID, and I responded that it wasn't, because it wasn't. The child was admitted. Initially, he was seen at GRMC, transferred over here because of the symptoms he was exhibiting, fever. And so the GRMC took a swab specimen, and we tested it here via the Abbott ID Now device that we have, and we received the result as negative. But we wanted to make sure, so we did another test. We did another swab the following day per the doctor's order, and also the specimen was sent to Public Health PCR. Both tests came back negative, so 3 tests showed that he did not have COVID. But, again, in making sure that we just continue to exercise precaution, we moved the individual. First of all, we admitted him to the pediatric unit. But then, to exercise all precautionary measures, and especially because, that was a pediatric unit, there were other pediatric patients. We want to make sure that we, contain, if he does have COVID, we contain that spread of infection and not, bring it over to the other pediatric patients. So we moved him. We moved the 12-year-old to the COVID Care Unit 3, which is, again, on the fourth floor, but, on the other side of the wing. And so we kept him isolated, and we exercised all the abundance of precaution to make sure that we protect also the staff. And, we just, also instructed the family that the parents, they can visit, but we made sure that they also don the protective, gear. And so, we managed his care. Unfortunately, his condition continued to deteriorate because his condition was really of a serious heart condition. And so, and unfortunately, Saturday night was when we lost him. And yes, the initial, the death certificate worksheet that the doctor had filled out, because, again, we were still thinking it's probable COVID, but that was not really the cause of death. The cause of death was because of his heart failure, the serious heart condition that he had. And so that's why, we in discussing it with the other physicians that were taking care of him, we all came to the agreement that the cause of death was not COVID. The kid did not have COVID. We were just exercising all the precautions.
Right. So at no point, Lillian, did this boy test positive for COVID-19? No, never?
No, at no point about did any of the Abbott tests or PCR tests come back positive. It was all negative.
And how would you explain to the public the death certificate thing? And are you able to tell us what did it say about COVID in that? What did you call it? A worksheet?
Well, whenever a patient passes away, the physician, the attending physician, fills out a death certificate worksheet. That worksheet then gets transmitted over to public health to then, put it on an official death certificate record that Vital Statistics prepares. And so the worksheet is a GMH document, and it gets, transmitted over to public health, and public health puts it on a formal death certificate document. That death certificate document, it's not, I think in certain states, it is viewed as a public document, and other people can request for it. But I think Guam law, it's not a public document. It's requested by, I guess, family. Relatives and families can request for it. So I don't think that Guam law recognizes a death certificate as a public document.
Right. So, Lillian, what has the family said throughout this time? Because I can't imagine, and especially you guys were treating it like COVID because it was isolated. The family had to don the PPEs.
Sure.
So how did you reconcile that with the family going from where we'd heard they thought it was COVID. Some even said they were told it was COVID, and then it wasn't. So how did that work out with discussing that with the family?
I can't say because I did not have access to the family. I did not have direct communication or, again, access to the family. But, they're grieving. They're hurting. And so we need to respect that. They lost a child. And for any parent, for anybody, that's painful to endure. And so we want to respect that. But in terms of, being informed that, he has COVID, again, it's probable that he may have had it prior to coming to the hospital.
Why would you say that, though, Lillian, if he tested negative 3 times?
Well, I understand that he was sick prior to coming to the hospital. So, again, we were exercising precautions as much as we possibly can to make sure that it does it to protect the employees and to protect other people. Right. And so, I mean, that's the nature of how we handle patients who may have COVID.
Right. So at any time, were there any antibodies of the virus that were detected in the boy?
Yes, the doctor also ordered a serological antibody testing, and that was validated by the DLS lab in Hawaii that he had IgG. IgG is the antibody that, when a person is infected with the COVID coronavirus, the IgG is produced by the body, the antibodies. And so, yes, he had the serological test, and yes, he had IgG in his system. So it may be an indication that he had COVID prior to coming to the hospital. So.
But am I just not asking right? Because I thought I asked you if he had any time tested positive for COVID-19, and you just said no. So maybe you can explain that better.
Chris, if you listen, the test that we run to test for COVID is the Abbott test and the PCR. IgG is not a test of COVID. It's a test of antibody.
Okay.
Which would indicate whether or not they may have had COVID in the past?
They may have passed COVID, coronavirus infection.
Which would, I guess, for the physicians who were watching this child, was the PCR done prior to him being moved to the COVID care unit?
I don't know exactly when they did the Abbott and the PCR test, because
the serology test.
Again, I don't know the date that the test was done. The doctor ordered. I don't know exactly when it was done.
So Lillian, is it can you say if he had the COVID antibodies, was COVID in any way a contributing factor to the boys passing? Because you can see the optics of it, right? Especially for us lay people who aren't hospital administrators or doctors, our understanding of this, maybe it's not where yours is, but if we're hearing that he tested negative, but that there was the IgG where the COVID antibodies were there, doesn't that mean that his body was fighting COVID?
No, he's recovered from COVID. He's past the COVID. It's an indication that it's a past COVID condition. So he, again, it's not the cause of death. The cause of death was his heart condition, not COVID.
So we're clear. The serology test only will show an indication whether or not somebody has recovered from COVID, has had it in the past. Whereas the PCR,
that's what the serology test indicates, that there are antibodies in a person's system.
And the PCR would determine whether or not they have COVID currently.
The PCR will be the one that's testing if there is a present COVID condition, infection.
So if I got the IgG and you guys found COVID antibodies in me, the determination would then be that I had COVID, not that I have it.
Most probably that you had COVID and you've recovered from it.
Right. Can we go back to how common is it to change a death certificate worksheet?
It's again, I'm not a physician, but it's not like Dr. Magnolia said, it's not an uncommon. Especially if they do an autopsy and they find other situations that may not have been visible at the time of death, but an autopsy can confirm something. So then, therefore, that death certificate can be changed.
Right. And so, as far as now that with the death certificate, it has been changed, right?
It is reflecting heart failure.
Okay, so that
so it was changed.
Yes, it is.
And it was changed because the initial certificate or initial worksheet said that he passed away from COVID.
Right, and it's not.
Okay.
That's not true. That's not accurate.
Okay.
He did not pass away because of COVID.
All right. Well, I want to thank you for
clearing that up
for us. Are you clear on that, Bree?
Yeah, I'm clear.
Okay, Lillian, can we get an update on the hospital? How are you guys doing? And I heard something, I wasn't sure, I was probably going to send a FOIA, but was there an emergency procurement that you guys did for like a computer program or something?
It's not an emergency procurement. We have been in the process of, upgrading our electronic health record system, our EHR. that we've been talking about. We haven't been, we've been letting people know that we need to upgrade it because the current system that we have is getting sunsetted. It's going to be faded out or phased out. So we need to make sure that we have, the computer system, computer hardware, the computer software, peopleware. We need to make sure we move along with getting people trained for the system. So it's not so much an emergency procurement. It's an ongoing. We've been doing this, and so I don't know what information you heard that there's an emergency procurement.
Lillian, you know it is when you hear, you don't know if you don't ask, right? So.
Well, yeah, I honestly don't know.
I mean, how many times have I asked you a question and you've been like, where the hell did you hear that, Chris? What? Federal authorities, huh?
I didn't see where the hell you're going.
It's like my grandma said, if you're shy, you don't try, so I'm just trying.
Yeah, but we are procuring some stuff for our electronic health system, and that includes computerware, software.
Mm-hmm.
Okay.
We haven't heard a lot. It's been because of everything that's happened with COVID, but the Army Corps of Engineers report, what is the status of that?
Well, it got final. It's in the website, and the Board of Trustees, we talked about it, in fact, last week at our at the board meeting. Some of the senators have been given a copy of it per their request, but it is a public document now that it's a final report. And so, based on what, it's basically essentially the same as what they had when they did the exit conference back in November. The many things that this facility needs to be repaired and replaced, such as the leaking roof, the HVAC system, the electrical panel, the envelope system of the hospital where the windows are leaking, the computer system, there's exhaust, the exhaust that needs to be repaired or replaced. So, basically what we pretty much know have been problematic and have been requesting for capital improvement funding to get these, repaired and replaced. It's essentially all in that Army Corps report, and that's available.
Was there any sort of recommendation like we just need a new hospital?
They did. They recommended two things. They recommended a new hospital at a certain price of $743 million. They recommended fixing, all that needs to be fixed at a price of $761 million. So, it doesn't take a rocket scientist, right? Scientists might as well spend that $700 million to build a new hospital.
Mm-hmm.
And so that's the direction that, the governor is leading, is that we need to build a new hospital. But in the meantime, we still need to operate this facility because building a new hospital takes 5-7 years. And so we still need to continue the operations, and we still need to make sure that, the care we provide patients is in a safe facility.
Right. What about is there a transition, Lillian? GMH is the COVID hospital now that, it kind of, is COVID over? Are we transitioning from that?
COVID is not over, Chris, and I don't think it's going to be over. It's in our community. So we need to continue to exercise, diligence and be cognizant and continue the measures that have been put into effect as far as social distancing, masks, and hand washing. It's not over. COVID is not over.
But
I'm sorry, but, I think that's the fact. It's just not over.
I agree.
So when
what was that?
I was going to ask if the governor lifts her public health state of emergency. I think it's ongoing until the 30th of June. Say she lifts it at that point, are we going to stop the non-COVID hospital agreement with GRMC?
No, I don't think so, because we continue to, we continue to have people come in and treat them as possible COVID, so we run the test on them. GRMC does the same thing when they accept patients into the emergency room with symptoms of fever or any other associated symptoms with COVID. They also do a specimen swab, and then they refer them over to GMH. But we are in this. We continue to. We're a hospital. We can't. We just have to continue treating every patient that comes through who needs medical attention as potential PUI, possible PUI, and and run the test. And if they are negative, which will be a good sign, then we just admit them as regular patients, not COVID patients.
How key has it been for you guys to have your own testing capabilities at the hospital, Lillian?
It's great. It helps with the flow and making the decision, quicker. So they don't have to wait in a COVID unit, waiting for the results for a day or 2 days for public health to give us the results. We get the results in 30 minutes, and so it gives us a clear direction that okay, this patient can go to medical surgical, this patient can go to telemetry. We don't have to have them wait in the Care 1 unit.
Do you have the status of the grandfather and the grandson who tested positive?
No, I don't, because they're no longer in our facility. They're no longer in our care, in our authority, in our responsibility. So they were discharged to the government-sponsored isolation facility.
And you said how many COVID care units are at GMH?
Well, we have the first one, which we opened up, which is our former urgent care unit. That was the first COVID care unit that, when we were receiving patients who are PUI, that has a capacity of 5 exam rooms. One of them is a complete isolation room that we had that was structured to be the Ebola isolation room. So that's one area. Adjacent to it is the Care Unit 2, COVID Care Unit 2, which is also between ER and ICU. And we've upgraded that to the capacity of intensive care units. If a COVID patient comes in and needs an ICU level of care on a ventilator, it's right close to the ICU between ER. So that's Care 2. On the 4th floor, the old pediatric unit, it's actually a 20-some, about 20 bed capacity on that 4th floor. That's our COVID Care 3 unit. So the whole area, it's 17 beds. We can accommodate, 17 individuals with COVID and keep them contained and isolated.
How many people do you have in each of the units?
Well, the maximum capacity for the Care 1 is 5. Maximum in Care 2 is 5 also. And then on the Care 3, maximum capacity is 17. We still also have the 5th, the COVID isolation facility, which is our skilled nursing facility in Barragata High. That's another extension for more of a downgrade level of COVID individuals who still need to be in an isolation situation, but are not able to go home yet because their home is not, adequate to continue the isolation measures.
So how many are in COVID 1?
COVID 1, that's Care 1, that's 5 beds.
Yeah, how many
COVID 2
people?
None right now.
Okay.
We don't have any COVID patients right now.
So no COVID. Okay. No hospitalizations.
No COVID patients in the house.
Lillian, I'm just starting to get some messages from some of my medical friends. So I kind of want to go back to this. Boy, just if you could maybe address. One writes, the way we approach our cases is would this person still have passed if it wasn't for X, Y, and Z? And so I guess my question to you is, we detected the presence of antibodies in the boy. So do you think he would have passed from his condition if he hadn't been infected with the virus?
Oh, I can't say that because I don't have all the facts, all the data on this child, other than he came in with the high fever and with the heart condition, serious heart condition.
Was an autopsy conducted?
No, autopsy was not conducted because it was here for more than 24 hours. If he was here for less than 24 hours, then that becomes a coroner's case, a CAB case. And so, yes, an autopsy would have been done.
And just for clarification, when I asked about the COVID care units and whether or not there were any patients in any of them, are there any probable cases?
No, not even that. They were brought into ER, but they were tested, and the test came back negative. So we have 7 individuals in the emergency room waiting to be for an inpatient bed.
Lillian, have there been any other death certificates that reflected COVID that were later changed after the fact for whatever reason?
No, not at all. Because the 5 that have passed were definitely COVID because the tests were positive. The COVID tests, the PCR tests on the Abbott were
Mm-hmm.
positive. And at that time, we weren't doing IgG serological antibody testing at that time.
I know last we spoke, you had mentioned that GMH had received, I think it was $12 million in federal funds, CARES funds.
11.5.
11.5. Has all that been expended already? And have you received any additional funds?
No, we haven't. But I just want to clarify that of that 11.5, 4.5 was really an advance. It was an advance. They call it advance Medicare payment, meaning Medicare gave it to us in advance of claims that we're going to submit for Medicare patients. And so that's really kind of like a loan. You know, they give you an advance payment, and so we may have to pay that back.
I see.
So we're reserving that as not counting. I made a mistake of counting that in the total of 11.5. But you know, those are funds that we received. So yeah.
So have you received any other additional, I guess, federal grants or anything like that?
Not recently, not this week, and not last week. So total, we have received $7 million, and yes, we have expended, some of those funds already.
Mm-hmm. And I know you were mentioning that you were working on chillers, right, or something like that for the
working on what?
SNU. You mentioned that you guys were working on. Was it chillers or something like that?
The chiller.
Yeah.
The chiller at SNU, right, to keep the facility air conditioned.
Right. And the elevators are fixed. And
all the elevators are working.
Okay.
Wow.
Yes.
And then we have amended, I thought I saw something about amended visiting hours.
We have, modified visiting hours.
There you go.
We are allowing one family member per patient for the time period of 5 p.m. to 8 p.m. And, they alternate. They can rotate, but they all have to kind of wait outside of the facility because we don't want, again, congregating in the lobby. We want to make sure that we follow the social distancing. So other family members, immediate family members, will just have to wait outside, and then they take turns going up and seeing their loved ones.
All right. Lillian, anything in closing you want to add before we let you go?
Well, just again, for everybody to continue the measures of, containing and prevention of further transmission of this infection, because it's just insidious. We don't know who's got it. So we just have to make sure we follow the social distancing, wear your mask, wash your hands, and if you don't have a sink and a soap, then use hand sanitizers.
Okay.
Lillian, have you been out to dine in, or you don't really seem like you're in a hurry to dine in with what you're saying?
I like to. My husband and I would like to go out, but I haven't had time. And my husband does the cooking, so we don't go anywhere.
All right.
Yeah.
Okay.
All right. Take care, Lynn.
Take it easy, Lillian. Wash your hands.
Take care.
Okay.
Yes, wash your hands and stay safe.
Okay, you too.
All righty. Bye-bye.
9:07. Yeah. So thank you again to Lillian for providing that insight. Did you feel that it was? I want to kind of take what she said and then maybe run it by some doctors.
Yeah.
9:07. We'll take a short break and we're back with more of the KUAM News takeover of Guam's favorite. It is containing COVID. Good morning.
Locally roasted. Keeping you informed. KUAM News brings you Banking 671. Brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 Virtual Relay for Life Guam.
Be healthy. Be informed with ITD.
Just reminiscing of that one more night in the spring.
Sorry. 9/11.
Oh, but you pick me up every morning.
Wow. Hey, it's the second day of June. Containing COVID, the KUAM News Takeover, Guam's favorite. Let's go over to the Mayor's Council of Guam, where the Executive Director, Angel Sablan, is on. Angel, I'm kind of excited for you guys. You're having your first meeting since the COVID tomorrow, right?
Yes, and it'll be at the Delito Community Center because, you know, our place down here is not big enough to do our social distancing, right. So we're moving up to the Delito Senior Center.
Just logistically, Angel, how hard was it for you guys to map out the social distancing and to figure out where everyone's going to go to make the allowances for the staff and all that?
Yeah, well, you know, it's the center there is much bigger than the place we're using down here as our conference room. So we've already mapped it out. Just, you know, we just have the 6-foot tables, and it's very easy. Mm-hmm. One person at each end. So
is everybody confirmed to attend, or some going to be participating virtually, or?
No, there's not going to be no virtual. They will have to come and attend, and also we're inviting you guys because part of the agenda is whatever villages want to report as to what's been happening in the village and what actions they've taken to assist with this COVID-19. And then we're going to give the media an opportunity to ask a question or two.
Nice. That's thoughtful. What about, you know, Angel, one of the things I like about you guys' meetings is there's always a good spread afterwards. Are you guys, I mean, with the social distancing, yeah. I mean, how are you going to, is there going to be food?
Oh, this is going to be food. Agate is serving tomorrow.
Agate.
So it's going to be mango, everything.
There'll probably be mango, yeah.
I got to text Mayor Kevin. What's on the agenda for tomorrow, Angel?
Well, aside from just having the mayor's report as to their villages and the media asking questions, and we also still have the unfinished business, of course, the stray dogs, the animal roundup, and then the recycling revolving funds that we're anticipating to get here shortly. and then of course the news that we're not going to be doing liberation this year.
Right. Let's just start with the stray dogs. I think it was one of your last meetings before the COVID that you had the agriculture director on there to kind of pitch the idea to you guys. Is that plan, that program, has it been at a standstill?
Yeah, it has been, but just recently with Mayor Rudy Matanani, the chair of this, we're trying now to. Each village actually has already gotten a one or two cages to not only catch stray dogs or animals, but also for feral pigs. And then the Department of Agriculture is also working out a program to obtain or procure more cages to issue out to the villagers. So yeah, it's moving. It has legs now.
And what about the recycling? The issues with the recycling revolving fund?
Recycling revolving fund, the MOA is still being worked on by Guam EPA. We're supposed to get it here very shortly for our review, and then once, of course, I sign up on it, it goes back to EPA for their signatures, and it goes to the Attorney General's office, and from there it goes to BBMR and then to the governor. So we're putting a fast track on it. We have the Special Assistant on Municipal Affairs from the governor's office, former Mayor Bob Lizama, handling that one. So we're anticipating, again, it's going to be about $500,000. We don't have that much time frame left over for the fiscal year, because by the time we get this out, maybe it's the end of June, so July, August, September, and then of course we still have to get our contractors on board and check whether they're still, all of them are operating or not operating.
I'm not sure if this is even too soon to ask, but what about the reopening of senior centers?
That's probably, unfortunately, Bree, that's probably going to be the last ones. I don't think we're going to be opening that until we get into
four. Okay.
Yeah.
Okay. I thought I'd ask. I think one of our viewers was asking just for an update on that.
That's got to be right
We're
there with
going
the
to continue
schools.
to provide them the food, the nutrition that they need. But as far as them coming back to the center and gathering, that's right now, the senior centers of Derrido and Tamuning and Sinahanya and Manila are the bigger centers, and it's not possible to put all of them, the clients in there that usually come at one time.
Yeah.
Angel, I know that in passing you had said that you guys were going to be discussing Bill 255, and I was surprised that they're discussing it in the session because I haven't heard about it since before the COVID. So, people, I don't know what notices went out, but I was watching the session last night, and you guys were kind of key on this with the resolution that you guys did. And this is the health insurance choice bill. And, Lord knows people have had many issues with Aetna, but I think as we turn the corner on those, it's kind of become about giving these GovGuam employees, and especially the retirees, because, they're set in their ways. They want that choice, right? So what type of discussion are you guys going to be having during the meeting tomorrow about this choice bill?
Well, probably the same lively discussion we had the last time we brought it up. And we're still looking forward to having a choice. We really want to have a choice.
Yeah, I remember speaking with Mayor Paul McDonald from Agania Heights, right? He was one of the main movers behind that resolution, and he was talking about, I guess, the nightmare that he went through just to get help in the Philippines.
Right. I mean, he's not the only one. We heard the same thing from one of the bill's authors, Senator Pito Terlahi, and not just from. I mean, these guys are high profile, right? But my phone was just. I mean, still, we get messages about just people frustrated, and I think part of it is that it's hard for them to get the answers locally or whatever, and that was something that we had heard a lot. But again, like going just back to having that choice, how key is it, do you think, especially for the retirees? They're the ones who are using this insurance the most. Your thoughts on that, Angel?
Well, like I said, we'll bring it up tomorrow, and I'm sure we're not going to be short in the discussion. I mean, I know the mayors would come up and again bring it up. I mean, COVID has put it probably on the flat burner for now, but it's coming up, and it's on session, so it's something that we and really look forward to having the legislature act on, and come up with a bill that can address it.
Right. Well, I think the bill's there.
Yeah, it is.
I mean, a fast one.
Right.
Yeah.
Okay.
Well, thanks, Angel. We're getting Mayor McDonald on in a few minutes, I'm pretty sure we'll discuss this more. But I just wanted to catch up with you guys because I thought it was interesting. You hardly see a body like the Mayor's Council kind of wait. I know you guys do your individual testimonies, but for you guys as a body to kind of weigh in and put out this resolution and say, yeah, we want a choice. I thought it was pretty telling and a pretty big statement.
Mm-hmm. And of course, also tomorrow we're going to welcome the mayor-elect of Jonia. We've invited him to the meeting.
What? So you guys going to jump him in or what?
We're going to welcome him.
Does he have to be sworn in?
Yes, he has to be. He's going to have that. The Guam Election Commission is having their meeting on the 12th, so that's the soonest that he can be certified. But he's already up and around. I mean, he called me this morning, and he's already up at the mayor's office, and he's working with the staff there and just getting himself acclimated and acquainted to what has to be done. I mean, even though he's not sworn in, we don't think that there's any way that any more votes that are going to come in the next 10 days are going to change the results.
I mean, he won by a pretty handy margin.
Yeah, that's correct.
Right.
Yes.
And Angel, or Bree, I'm sorry, I don't want to sound naive, but too late. So he's just going to be there until the primary?
Yeah, I mean,
well, if he's going to run for mayor again, he has to file his candidacy before the end of this month,
right?
And be a candidate in August. And if he prevails there amongst the Democratic candidates, because this time there's going to be two sides,
right,
Republican and Democrat. Then he will move into the election in November. And no, he doesn't just stay to the primary. He will stay all the way till a new mayor or himself again is elected for office in January.
Is he going to be sitting in former Mayor Blas's old chair?
We
haven't bought a new chair, so yes, he'll be sitting there.
All right, thanks, Angel.
Yeah, thank you, Angel.
You're welcome.
And let's catch up after the meeting.
Take care. Be safe. Come to the meeting tomorrow, if anything, to have some good chow.
All right.
Okay, because the South can cook. Yep, I tell you, the best meetings, guys, Agate and Umatic. That's when, and in Iran. That's when, and Malesso. Yep, okay.
Right.
Okay, thanks, Angel.
Okay.
Bye.
Thank you.
All right.
Take care. Be safe.
Wash your hands.
Okay, bye-bye.
All right, Angel Sablan, the executive director of the Mayor's Council of Guam. 9:22. We'll take a little break and come back with more of the KUAM News takeover of Guam's favorite containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 virtual Relay for Life Guam.
healthy. Be informed with ITD.
I do my Frank Hogan wave. Gotta get down low. You ever notice Frank Hogan and Ray Tenorio have a similar wave? It's all, you know what's key is the eye contact. Good morning, 924. It's containing COVID. Let's go to the phones. We'll stick with the mayors, and we'll get Mayor Paul McDonald on to the show. Good morning, Mayor.
Good morning, Chris.
Hey, just wanted to bring you on here. First of all, before we get into this choice bill, I saw that you guys are doing something cool in Agania Heights for the graduates. You want to talk a little bit about that? There's a wall that you're putting up banners to honor the graduates from Agania Heights, right?
Yes, and we actually feel bad because of the situation, and the graduates, wherever you're graduating from, deserve recognition, for their accomplishment, and this is the least we could do for them. And the response was overwhelming. We thought we were just going to have a few, but now, when we started to put up the pictures, we're receiving a lot of phone calls from other graduates, and that's the whole idea, is to recognize these youngsters that you've accomplished something that we actually wish that everybody would do, no?
Right. Yeah. And it was really cool. We'll promo it this week, Mayor. I got the pictures from the staff, but I wanted to get you on here because you were one of the first voices really to raise concerns about this sole source health insurance contract. So we know you definitely had your issues with Aetna, right? And this stemmed from the way you were treated when you went off island for medical care.
Yes, Chris, and I actually feel for the other patients too that were there when I was being seen in St. Luke's. As a matter of fact, several of them, I don't know how they actually survived out there when we had so many unknowns and surprises of what's covered and what's not covered. They should make it clear even before a patient leaves here, and that it's not a sure thing that you're going to be helped with the bills, and everybody gets insurance because of the purpose of helping us pay up, especially for we can't afford the bills from the hospital. It's just terrible.
The mayor has kind of snuck up on me, I think because of the COVID, but they're actually hearing this bill in the session this week. So have you been in contact with any of your friends down in the Guam legislature, and what's their take on this?
Yes, Chris, it's the legislature Are you there to help the people or help the government? You know, that's the question that they should ask themselves. You know, and if it's going to cost us a couple dollars more, then please, you know, let's lessen the burden for the patients that don't have money and make it convenient for them.
Mm-hmm.
First of all, especially when you're referred off island, right? You don't have the resources to go back, and a lot of people would have no resource to go back and borrow money while you're there, being treated for whatever ailment you have. And then, you know, that's what I've actually spoke to a lot of the senators about. And apparently we the mayor's council, I introduced a resolution, and apparently everybody in the mayor's council agree.
Right.
You know, and I hope that the legislature will be considerate about our people being treated, you know, especially off island.
Right, and I think there's two prongs to this. Is there's the way people are bitter about how they were treated, especially a lot of the retirees. Man, I've heard, and it's so heartbreaking because, you know, our Manomco not the healthiest generation, and that's so right. they do a lot of, they use the insurance a lot, they go off island a lot. I've just heard so many sob stories about it. And then the flip side is that people just want to have a choice, you know what I mean?
Of course.
Right. And so I think it's interesting that so much time has passed since this was first discussed that I'm not sure if the senators have forgotten the support that this measure has and the urgency that was communicated with the resolution from the Mayor's Council of Guam. I know that there was petitions going around, you know, signed by thousands of people. So people obviously have their opinion about this, especially when you ask the GovGuam employees and the retirees. But now it's kind of shifted to this conversation about the cost of it. And I was just thinking last night when I was doing my beach walk, you know, like healthcare, that's one thing you don't want the Western family version of. You know, I think when it comes to especially our retirees who work so hard for this island, for this government, for the people, why are we going to skimp on them, you know?
That's right. And again, you know, it's just overwhelming when we were there. Oh my God! There were several people that were there that had to come home because they couldn't get any answers, or they couldn't get treated because they cannot afford it. You know, it's very sad, and like I said, you know, that we should have the choice. We should have the choice. And, you know, competition, right, is good, too.
Yeah, I mean, it's good for everything except for apparently the health insurance now.
Right.
You know, I was watching the session last night, and I kind of, it was Senator Piro Terlahi was asked a question by Senator Regine, and it was, there was something in the bill that she'd asked him about, and he just kind of went off in Chamorro saying, basically what you're saying, like, hey, are we here to help the people or not? You know what I mean? That's what we're elected to do?
Exactly.
If we're not here to help the people, then why are we even here?
Exactly. And you know, it's when I said, you know, in the beginning, it's either you want the government or you're helping the people. You know, and Chris, I don't believe in government making money. You know, it's helping people.
Right.
You know, and by golly, if we didn't have this situation now with this COVID thing, the Corona thing, I'm pretty sure that you're going to hear a lot more from people that are being treated off island.
Right, and I think that's why, I mean, you know, I understand the timing of it, and they're getting it in before the negotiating team meets, but I think it's key that people know that this is being discussed, because I don't think they do.
That's right.
And so, you know, call your senators, especially the retirees. I was on the phone with Mr. Leon Guerrero from the Retirement Fund this morning, and he didn't even know they were hearing the bill. I said, yeah, Mr. LG, you better check your your people, where they stand on this, because I'm hearing a lot of grumbling from the retirees.
Yes, and you know, Chris, I've met a lot of people that are saying they're not going to enroll on insurance. I go, guys, that's dangerous, you know. You can, everybody's prone to accidents, and if you get into an accident, what, but that's exactly why we're buying insurance, for that we get insured, so that we can afford to live on, and get treated.
Just in case, Mayor.
Yeah.
Well, we know you're going to discuss it in the meeting tomorrow. What kind of discussion are you guys are you looking forward to, Mayor?
Oh, I don't know if anybody brings it up. What can we do? The legislature, a lot of them don't listen to us. We have a resolution already, and they should look at it and reconsider the no choice, and give us the choice.
Right on. And Mayor, I think you got to do your part too, and run this up the flagpole, let people know that this is what's being discussed this week, because I usually pay attention, but it's snuck by me. So.
Yeah. No, I'm gonna suggest to my colleagues that they contact all these their constituents to call your senator and tell them, we need insurance, and we need affordable insurance, and we need to know, and not to go off island and you don't know what you're gonna run into.
Right. Yeah. Well, thank you, Mayor.
You're welcome.
And we'll catch up with you after the meeting, okay?
Yes, sir.
All right, you go tell Tanana and Tun Pete.
Hasta. Adios.
Okay.
Okay.
So wash your hands. Hey, Sabrina.
Hey.
Sabrina was working on something over there that you always work. That's good.
Working on news.
Right. Hey, let's keep with the phones here. And, there was a protest yesterday. I know you saw that, Bree. And
Yes,
it was a local support of Black Lives Matter, right?
Right.
And so there's one coming on Friday. And so we wanted to bring...
I don't know if it's two or if it's
there
one.
There were two, yeah.
Right?
So there's one yesterday, and then there's one on Friday.
No, I thought I saw two for Friday, but I mean, it could be.
Well, I mean, yeah, the more the merrier. So we want to bring Nola Hicks on, and Nola, just before we introduce you, that you are working with Guam, the Guam Black Network, right? And they said that you're organizing this protest on Friday. Are we calling it a protest, a demonstration? What are we calling it, Nola?
We're going to call it a peaceful demonstration.
Okay.
Protest just has that ring to it, right?
Protest has a ring to it, very negative. There are going to be two events on Friday. I'm actually in contact with the the youth group that's hosting the one in Agana. And basically, like Chris said, more the merrier. We're just trying to raise awareness of what's happening, stand in solidarity with, Black people across America, the injustices that are happening. A lot of commentary online has been, well, we have, local issues that we need to address. Those are more of a priority. My response to that is, hey, in order for us to be able to address these issues, we need to raise our voices, we need to stand up, and we need to take action in order for us to really perpetuate change. So I commend, the peaceful demonstration yesterday. There's going to be two on Friday, and it's just basically us trying to raise awareness that, Black lives do matter. We can no longer be just, a form of entertainment. A lot that's happening, you guys are seeing it as, main point of contact within the media. You're seeing what's spilling across America, whether it be positive or negative. The intentions behind bringing awareness to this is basically the injustices that cannot be tolerated. So I just, I welcome the Guam community to come out, to stand in solidarity. It's 10 or 15 minutes of your time, just to show your support. I was able to meet with the Tumbling mayor yesterday. Very, very nice lady.
Yeah, we love her.
She's great. I'm looking forward to meeting with GPD today and local law enforcement to get them to come out if you condone the type of behavior that's happening in the States, come out, express those concerns. And, I just feel like if everybody would do their part, the world would be a better place. The world was sick before the pandemic. So, we need to be able to heal the world and do our part as citizens to make sure that we bring attention to these issues that are happening.
Nola, are you part of any organization?
Well, so I basically just moved here from Saipan. My husband is the new assistant U.S. attorney for the federal office here. I basically just formed the NMI community of Guam. And, with that, I'm just, I'm basically trying to rally people from the CNMI that have moved here to Guam. Guam has always been so responsive, to the types of disasters that we have, whatever it is that we have at home. Guam is always pretty quick to respond. My thing is that what are we doing, here as citizens from the NMI to support Guam? I think that there are little things that we could do to help, tackle a few of the issues, whether it be, poverty or homelessness. We need to be able to do our part. So I'm forming that group, and, most people know me as the Democratic chair for the party on Saipan. I'm not trying to bring politics into this. It's more of just an organized effort to raise awareness on a serious issue. So hopefully people can look beyond that and, open their minds and their hearts into the reality of just what we're facing.
Nola, I was thinking, I think we had another protest. I don't know if it was last year, but the point is that this keeps happening, right? We keep having these flashpoint incidents where police or authority figures unjustly are murdering people of color. So how does it feel to keep having to do this? And it just seems like the concern and the cause, it just gets bigger every time, So
it's horrible, Chris. It's absolutely horrible. And it's one thing for me to be half black. I'm married to somebody who's white, who, works for law enforcement. He's a prosecutor, and we stated this very clearly on our message. Not all blacks are criminals, not all whites are racist, not all cops are bad. Ignorance comes in all forms. I think, it's finally exploded to a point where people are dealing with the pandemic. And it's sad to say, I've been talking to, a lot of my black counterparts in the States from different organizations, and, for them to say things like, COVID kept us safe because we were indoors, that is just absolutely horrible. Nobody in 2020 should have to be living in fear because of the color of their skin. And, I'm very, very thankful that, the Guam Black Network is showing their support, because if anybody needs to hear the stories, it needs to come from black people. Having to worry about, your son, going to the store or walking to the park, in this day and age in 2020. And I think if there's something that we can all agree on, beyond party lines, is that nobody deserves to die. Like, that's just absolutely horrible with the videos that are being shown via social media, with what happened to George Floyd. Regardless of the crime that was committed, he did not deserve to die. I think we can all agree that he did not deserve to die. And a lot of these innocent black people that are being murdered across America do not deserve to die. So we just need to come in together and to address these issues and to voice our concerns, so that there can be reform in the justice system. And I'm speaking to the people of Guam as a person of color, as a person that cares, as a person that's married to somebody who works for the justice system that is constantly failing us. So we just need to be able to fix that. We need to call on our leaders to help us fix that. So I appreciate the dialogue.
Nola, you told me yesterday that you were working to get a hold of the Guam Police Department to have some kind of a presence at this demonstration Friday. What has the conversation been like on that end?
Well, I'm actually going to be meeting with them today. Like I said, my husband will be there. He works for the feds. He's going to be there. I did get some positive feedback from the fire department. They were going to show up. I expect, the Guam Police Department to show up. I mean, I feel like it's local culture. I'm, my mom speaks fluent Chamorro, Carolinian. This is what we're about. We're about getting together to help our brothers and sisters in need, and I can totally see them coming out. I plan to meet with them later this morning, and once I get that confirmation, I'll be sure to let everybody know that the Guam Police Department stands in solidarity with what's happening in the U.S. because I'm sure you've seen a lot of police officers have come out and have condoned that type of behavior, and that's important. I think the first step is acknowledging that there's a problem and not just sinking your head into the sand and hoping that it'll go away. And that's one thing that I also want to emphasize to the public. Nobody is forcing you to come out. All this unnecessary, commentary about, this is bad, they're following the state, there's going to be looters. Nobody is forcing you to come out. We're asking you to wear a mask. There will be social distancing from the curbside to make sure that people are following the protocol. But, if you don't want to come out, we're not forcing you to come out. We just want to show our peace. We want to be able to raise awareness and keep this as a positive thing.
Mm-hmm.
Nola, go ahead.
No, go ahead. No, I was going to ask, we haven't discussed where and what time.
Right. Oh, I was just going to say, it's interesting to me that a lot of these issues that we're seeing unfold and we've seen for, not just this year, last year, but, decades, centuries. Do you think we have those issues here on Guam?
And that's a good thing that you brought that up. I think racism exists everywhere. I think we all have a little bit of prejudice in us, whether it be towards colleagues in the office, whether it be towards women, whether it be towards the LGBTQ community. I mean, we have prejudices against religion. It's like everybody has something to say. And, whether or not it's right, we need to acknowledge that it has been a problem. I think more particularly on people of color, but racism does exist. It definitely exists on Guam. I've seen it in the short time that we've been here. This racism against Chukis is just, it's horrible. But at the same time, that's the stigma within the society. And in order for us to really acknowledge these differences, we need to be able to come out and say it exists. We're not. I think that's the biggest problem. People don't want to acknowledge that it exists. So with everything that's going on, I think this is a first big step in acknowledging that it can no longer be tolerated.
Mm-hmm. And again, this peaceful demonstration, it's for everybody, right? It's not
It is for everybody. I want students to come out, veterans, law enforcement. I've invited a few of the senators to come out. That lovely Tamuning mayor will be there. She's given her support. So yeah, I really do hope a lot of people come out and support. Once again, it's going to be at the ITC intersection, the same place that they had it yesterday. It'll be from 4 o'clock to 6 o'clock. The one in Adaloop, of course, is going to be from 3 to 5. We figured people would still be on, within the office, so 6 o'clock would be a good time for them to be able to come out even for 5 or 10 minutes. And if they wanted to be able to, if they can't show up, they can email nmicog@gmail.com for more info on how to show their support or make a donation.
You got shirts, I saw.
Yeah, so we're going to be having some shirts printed. The Guam Black Network is donating these Black Lives Matter medallions to show their support for people that come out. So yeah, I think it's going to be a really a positive thing. Like I said, we want to raise awareness. We don't want no trouble. Black people just want to live peacefully. That's the message. So I hope everybody will understand that.
All right. Is there anything else you wanted to get out?
That's it. I wanted to thank you guys for your time and allowing me to be able to educate the people of Guam on these type of struggles and hopefully, one day at a time. It's not just a local issue. These issues that happen in the States affect us greatly here. And, it's one positive step in the right direction. And I hope that, more people come out and use their voice to address certain issues. So thank you.
No, thank you, Nola, for your work. And you keep us posted. I know when you moved over here, you gave me a call. You said you want to do a lot of stuff in the community. So anytime you do any of that, give us a call and we'll put you on and help you promote it, okay?
Thank you so much, Chris and Sabrina. You guys have a great week.
Wash your hands.
See you Friday.
9:49. We actually had got a request to play this Department of Labor tutorial. Again, is that okay with you?
Yeah, I think that's very important.
We're going to play that. Watch this closely because everybody is saying it's a very complicated process.
Mm-hmm. And real quickly, again, if you want more information, make a donation. It's nmicog@gmail.com. The rally is protest, peaceful demonstration is this Friday, 4 to 6 p.m. at the ITC intersection in Mooning. Wear a mask.
All right. Oh, there you go. 9:48. Again, this is the tutorial for application for the Pandemic Unemployment Assistance, courtesy of the Department of Labor.
Half a day. When it comes to applying for unemployment benefits as it relates to the Pandemic Unemployment Assistance and Federal Pandemic Unemployment Compensation programs, the first thing you'll need to do is create an account and register on HireGuam.com. Utilizing this button rather than the Not Registered button at the upper right login box will ease the pool registration process as it was built specifically for the pool program. The first page you'll see is the welcome page that explains the pool program and the 10 scenarios of eligibility that caused unemployment. Read through it entirely, and if any pertain to you, click Next. Input your social security number and then re-enter to confirm. Notice at the top of the page, the eligibility section is completed and the registration process begins. In order to complete your registration process, you will be asked to provide the following: a username and password and select a security question, an email address, or if you don't have one, you will be required to create one with the link provided, your residential and mailing address if different, your preferred notification method to receive benefit notices and updates, any prior military or current military service, education, occupation, your preferred payment method, such as direct deposit or paper check. Now, if you opt for direct deposit, you will need to supply your bank account and routing number. And since these benefits are taxable, whether or not you would like your taxes withheld. When you see the page notifying you to proceed to make your PUA claim, you have completed the registration process and may continue to the work history portion of the claims process. Input your last employer data, job title, and employment information. When the system prompts you to enter your last day worked, make sure you enter the date in which your employment status was directly affected by COVID-19. For example, if you were furloughed on April 1st, 2020, but have since returned to work, you will enter April 1st and not yesterday. Complete the rest of your work history information and add as many past employers as needed. Once completed, you will be required to certify that all information is true and correct, that you are responsible to keep informed of program benefits and reading program material, and that you acknowledge that any false statements are punishable by law and could result in a fine, imprisonment, restitution, and a loss of future benefits. Read through PUA's to-do list and take note of the following. Immediately file your weekly claim. Report all income for the week to include tips, commissions, and gratuities, even if you have not yet been paid. If you return to your normal pre-pandemic work hours or return to work and make over $494, you must stop filing a weekly claim. You must be able and available for work. If you are offered your job back and refuse for a non-COVID related reason, you are no longer eligible to receive PUA benefits. And at PCOR 3, you must look for work by contacting at least 3 different employers about job openings. Be sure to upload a valid government-issued ID and supporting documents to strengthen your claim. Congratulations! You have completed the PUA claim filing process. It's time to file your weekly claim. Click on the File Your Weekly Claim button to proceed. Read through the explanation of the weekly certification process and advisories before proceeding. Notice that the weekly certification process begins the week in which you claimed as your last day of work. Answer each page honestly and input additional information as required. However, if you have since returned to work, be sure that on the weekly claim of the day you returned, you adjust your weekly earnings accordingly. Congratulations! You have filed your weekly claim. Make sure you file for all previous weeks you were affected to present. Now continue to file every week thereafter to receive unemployment benefits for those weeks. For more information on how the Guam Department of Labor can assist you, visit our website at dol.guam.gov.
Congratulations. Now you got to wait 21 days. Sorry. 9:54. So that's courtesy of the Department of Labor. Again, in talking to our digital teams, Ken Sanity, you guys might know him as Ken Nicholas, or you also might know him as one of the most legendary gamers the region has ever seen. His wife is an HR manager for a business, and he said that it was complicated for her to go in and apply for this benefit. But to quote a phrase, a very popular phrase that's going around, it is what it is. I mean, if you guys want
popular phrase,
obviously we have. That's what it is. It is what you got to apply. It's going to take a long time. You need a lot of documents. What did Dave say about them standing up GCC? Because GCC is where you're supposed to be able to go
if you don't have a computer,
right? And then they can.
And you got to make an appointment,
right? Yeah.
They have some phone numbers that you can call.
And I'm pretty sure, and I'll touch base with Hannah. She's handling all the PIO stuff for Department of Labor. But I think they should come out with, and I don't think they do.
Which?
They should come out with lists of like, this is the, and Dave had done this early on because he's been a weekly guest on the show pretty much since the COVID started. But they should come out with a list of like, this is what you need when you apply. So you need your.
Well, I think he did. They early on, yeah.
Early on, so
have
it'd be,
all these
it would be good
documents
to
ready.
Bring it up again and put it out there, right? Because now that we can actually apply, which is a good thing. I mean, it took forever, and there was just no action in the middle there. But it all came together at the end. And Dave was on this morning. Glitches, a few, of course, bugs, but they're anticipating ironing those out as the process goes on. He said like 4,000 people have applied.
Okay, I thought it was like 11, but I could be wrong.
Oh yeah, okay, I could be wrong.
Yeah, and also he does recommend that you get direct deposit because it'll be faster to transfer the money into your account when you go that route.
And that eliminates the need for having to go and jump through all these hoops to pick up a paper check. But the paper checks is still an option, okay? Because I know some people, for whatever reason, just maybe you don't want to go line up at the bank for 5 hours to open an account.
Are you a paper check type person?
Yeah, I like to see it.
Yeah, I was a paper check person, but then when we had to do the direct deposit, it's so much quicker.
Yeah, well, actually, I still got to do the direct deposit, Bree. It's just thanks for calling me out.
Oh, okay.
But I just haven't had time because obviously the banks are so crazy that, I mean, I'd have to take a day off to go open up a new account. Maybe I should open up a new account.
Why? You can't just use the account that you have? Or you don't have an account?
Yeah, I don't have an account.
Oh, okay. Then, yeah, you have to go out, open an account.
So maybe I'll take off tomorrow and I'll go.
Yeah, not happening.
9:57. As we always do at the end of the show, because we know sometimes, I mean, there was some heavy stuff this morning with Lillian and the 12-year-old boy. That was a heavy conversation. So we always try and end on a good note, and we're going to do it with Terry, who we're going to bring onto the show here. Good morning, Terry.
Hi, good morning.
Good morning.
Good morning.
So this is really cool. Now, your brother had passed, and so his daughter, your niece, is Mapotgi.
Well, actually, she gave birth already like 4 days ago.
Oh,
right,
congratulations.
So, yeah, congrats. A boy or girl?
It's a boy.
It's a boy, and we're going to show, I should have known that because you sent the videos.
Yeah.
So basically, because of the COVID, we weren't able to have baby showers and all that kind of stuff. And so what you had done, I think this is so cool, is you organized, what would you call this?
Well, actually, I wasn't the one who was the planner. It was her sister, Tara. She was the one who planned it, and then I guess, she got all the family and friends together, and what we did was we had a group chat, and she was telling us what, if we have any ideas and stuff. And I kind of like threw out some stuff like wearing shirts and decorating our vehicle, and it turned out very successful.
It did. And looking at this video, this is pretty cool. Is this something that you guys have kept secret from your niece?
Yeah. She was really emotional. She got emotional. She started to cry. If you notice in one of the videos, she was, I don't know, I'm starting to cry too.
Don't you start to cry, because then I'm going to cry. Sabrina, don't cry, though.
Yes, I do.
I've only ever seen you tear up.
It turned out perfect. It's too bad a lot of us couldn't get down to see the baby, but actually they could have, they could have just gotten down because the baby was in the room, and the grandmother, which is Evelyn, she was carrying the baby, to show everyone in the window.
Aww.
Through the window. So.
What's the baby's name?
Mason Ray.
Cute. That's
and we got the video up here now. If you guys can see, this is pretty cool. So there was a motorcade part, and then you also had people drive up. And what's going on here? Are you giving them plates of food or something?
Yeah, food and party favors. Yeah.
That's cute. And so your niece cried. You almost cried. How emotional was it for the people who? Because this is in lieu of what we would normally do, and baby showers. I've got a few in my history. It's always a great occasion where you're celebrating, right? And so how was this in lieu of that?
Well, I was kind of like sad, and you know how it is. Like you mentioned, we've gone through baby showers, and we prepared this like maybe a month before the shower, and then now that we're going through this pandemic, we can't really do much. I mean, we can't invite the whole family, which you know how it is here in Guam. There's like thousands of families, that come to the party. So, but it turned out perfect, and everybody was satisfied, even if they didn't get a chance to see the baby. But there's always later on, that they will get a chance to see him.
Right. Are you guys already planning the christening?
I'm not sure. Maybe we're gonna have to wait on that. I'm hoping we do, until it kind of like calms down a little.
Right.
When we get to Court 3, or but I'm not sure, but I'm pretty sure they'll plan something.
Right.
Well,
that's what I was wondering. Yeah,
good decision to wait.
If you're planning anything else that with the social distancing. But Terry, this is really cool, and we've seen so many examples of how our people of Guam, who are just so resilient, we get dealt a bad hand, we turn those cards into a winning hand, and this is just another it's another way to show that our spirit, whether it's COVID or economic, somehow we just keep on striving. And I wanted to bring you on to share this because. To us, you're a COVID hero, Terry.
Oh, thank you. Thank you very much, Chris, and thank you, KUAM.
All right, take care.
God bless you, Terry.
Okay, you too. Bye.
Wash your hands.
Oh, I will. Keep safe, guys.
And let me know if you're going to start a diaper drive anytime soon.
Oh, okay. That's great.
A good idea, right?
Yeah,
okay.
good.
Okay, Terry. Right. Thank you. 10:02. Guam's favorite. Good job today, Sabrina.
Good job.
Good job, Joe Sir. Ken Sanity, of course, on our Edward R. Murrow award-winning social media networks. Thank you guys for hanging with us on the show, on the radio. Again, KUAM TV 11. Thanks so much for watching. For Sabrina, my name is Chris.
Bye.
This has been Containing COVID, the KUAM News Takeover, Guam's favorite. Esta Joe.